collaborate with an institution of such repute, sir. 𝗟𝗶𝗳𝗶𝗰𝗶𝗲𝗃. Read in the name of your Lord who has created all that exists. Let us start the proceedings of today's session by listening to the Holy Quran. The verses will be recited by Dr. Abira.
Assalamu alaikum. The beautiful verses of the Holy Quran selected for recitation today are extracted from a dua made by Hazrat Ibrahim alayhi salam, in which he lists some of the qualities of Allah. Let's dive into the supplication. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الذي خلقني فهو يهدين والذي هو يطعمني ويسقين وإذا مرضت فهو يشفين والذي يميتني ثم يحيين والذي أطمع أن يغفر لي خطيئتي يوم الدين رب هب لي حكما وألحقني بالصالحين واجعل لي لسان صدق في الآخرين واجعلني من ورثة جنة النعيم. Now the translation. I seek refuge in Allah from Satan the accursed. In the name of Allah, most gracious, most merciful. It is He who created me, and it is He who guides me, and it is He who feeds me and gives me to drink, and when I am ill, it is He who cures me. And who will cause me to die, and then will bring me back to life, and who I hope will forgive me my faults on the day of resurrection. My Lord, bestow right judgment of the affairs on me, and joins me with the righteous, and guides me an honorable mention in the later generations, and make me one of the inheritors of the paradise of delight. Allah Almighty speaks the truth. Sadaqallahul Azim. These ayat were specially selected for the reason because as we were discussing yesterday also, that healing comes from within, healing comes from Almighty Allah. So especially for that reason, as lifestyle medicine is focusing that concept back to medical field, so that's why these ayat were selected. Thank you.
Jazakallah. The relevance of these verses to our gathering is profound. They highlight the holistic nature of health and well-being, reminding us that Allah is our ultimate creator, provider, and healer. They underscore the significance of nourishment, care during illness, and aspiration for divine guidance. These themes resonate deeply with the principles of lifestyle medicine, which advocate for a balanced, healthy lifestyle and a strong connection to spiritual well-being, ultimately leading us towards holistic health. As the host country of this international conference, and with pride in our identity as nationals of Pakistan, a country with a highly significant geopolitical position, where people from diverse cultures live together as one nation. The inaugural ceremony would be incomplete without saluting our heritage and paying tribute to Pakistan through our stirring national anthem. I would request everyone to rise in respect while the national anthem is played. 𝗟𝗶𝗳𝗲𝗏. After the tribute, we will start with the proceedings of the inaugural session of the conference, where a very rich and informative day awaits all the lifestyle medicine activists. Today, we have a blend of speakers who will talk about the topics they specialize in. So as I always request my audience on such occasions, put your seatbelts on and empty your glasses, right? And so whilst you fill them again from the fountains of knowledge, they do not overflow and spill out some important piece of advice. But before we delve into the heart of this conference, it's a long-standing tradition to seek the blessings and auspicious commencement from our chief guest. Professor Dr. Zafar Mirza, may I humbly request your permission to officially announce the 5th International Lifestyle Medicine Conference open. Thank you very much, sir. Starting the meeting, I'll be your host for the morning session today. I would thank Dr. 𝗟𝗶𝗳𝗏𝗏𝗏𝗏 for the trust she put in asking me for the conference the 3rd consecutive year. 2021, I was sitting in the audience just like you people, wishing I can be part of this dynamic team. Well, for those who know about the law of attraction or who have heard about the law of attraction, I am a living example. And for those who don't, I'll explain it in these words. This was first mentioned in the book, the very famous book, The Alchemist, where the author said, and when you want something, all the universe conspires in helping you to achieve it. So, words about the law of attraction to be explained is that when you vibrate at the right frequency, you will attract what you want, because the universe, on the will of the Creator, will join hands to provide it, as you have demanded it at the right frequency. So the frequency should be right when you demand it. It should come from the heart. So with that, I'll welcome you to another defining moment in the evolution of healthcare, the 5th International Conference of Lifestyle Medicine. Today, we are not just opening a conference, we are igniting a revolution that promised to reshape the very fabric of how we understand health and well-being. At the heart of this revolution lies a simple but profound truth. The key to lasting health has been within us. Lifestyle medicine is not just an approach, it is the future. It represents a powerful shift away from managing disease to preventing it, from treating symptoms to empowering individuals, and from reactive care to proactive wellness. We are gathered here under the theme Health Revolution, Lifestyle Medicine as your first choice for health, to challenge the status quo, to redefine the path to health, and to start a global transformation. The knowledge and ideas shared in this hall will ripple far beyond this room. They will shape communities, inspire change, and ignite a movement. Today, we are more than delegates, more than professionals. We are leaders of a global health revolution. The action we take and conversations we speak over the next few days will influence lives, policies, and the future of medicine. This conference is not just an event, it is a turning point. So as we embark on this extraordinary journey, let us embrace the challenge before us with courage, vision, and relentless passion. Let us light the torch of change that will guide healthcare towards a new dawn, a dawn where lifestyle medicine is not just an option, but the foundation of health for all. With that, I once again extend a warm welcome to each and every one of you. So together, let's ignite the revolution. The time is now, and the future begins today. So without wasting any further time, I would like to invite a dear friend and always my co-host in the Happiness Summit for the last few years, Dr. Ẓia Abbas, who will deliver the welcome address. Dr. Ẓia is an internal medicine specialist with a global career in healthcare and over 22 years of experience in clinical education. He joined lifestyle medicine in 2021 and became an IBLM diplomat in 2023. He is the president of the Pakistan Association of Lifestyle Medicine and serves as a board member of the Asian Council of Lifestyle Medicine. Dr. Ẓia has been instrumental in shaping lifestyle medicine education, ensuring that future generations of healthcare professionals are equipped with the tools to address the root causes of the chronic diseases. His work both as a clinician and an educator continues to inspire and lead a growing movement towards a healthier, more proactive approach to medicine. Please join me in welcoming him to the stage.
Bismillahirrahmanirrahim. Good morning, esteemed colleagues, distinguished guests, and participants from all around the globe. It is with great pleasure and honor that I welcome you all to the 5th Lifestyle Medicine Conference and Retreat. This conference, a cornerstone of global health initiative, serves as a platform for healthcare professionals, researchers, and policymakers to convene, collaborate, and advance in the field of lifestyle medicine. Over the past few years, the world has witnessed a growing awareness of a profound impact of lifestyle on health and well-being, from the rising rate of chronic disease to the increasing burden on the healthcare system. It is evident that lifestyle medicine offers a comprehensive and effective approach to address these challenges. This conference and retreat with the theme Health Revolution, Lifestyle Medicine as your first choice for health provides a unique opportunity to share knowledge, discuss emerging trends, and explore innovative strategies to promote health, lifestyle, and improve population health. It all started with an idea of our mentor to have a real life experience of lifestyle medicine in the form of a retreat with a very small group of people. That was the initial plan. With the amazing interest of our LM family and the continuation of our conference, the idea evolved, and a final product for the first time in lifestyle medicine came, where we joined the conference with a retreat. We wanted to make it a true experience. During the course of few days, we will delve into a wide range of topics, including nutrition, physical activity, stress management, sleep, and social connectedness. One of the key disciplines that we always focus on is self-care. And we will experience that during this conference and retreat. We already had some experience from last night of the retreat. I'm particularly excited about opportunity to connect with experts from diverse backgrounds and learn from their experiences. By fostering collaboration and exchange of ideas, we can collectively drive progress in lifestyle medicine and create a healthier future for all. I would like to extend my sincere gratitude to the organizing committee, sponsors, and all those who have contributed to the success of the conference. Your dedication and hard work have made this event possible. I urge you all to participate fully in the discussions, workshop, presentations that will take place over the next few days. Let us seize this opportunity to make it a lasting impact on the future of healthcare. I wish you all a fruitful and inspiring conference. Let us work together to shape a healthier world through the power of lifestyle medicine. Thank you very much.
Thank you very much, Dr. Zia. So, ever thought what lifestyle medicine is? One of my colleagues thought it was something for the rich class, like practicing posh medicine, till he realized by me explaining to him that it is actually the only treatment for reversing, curing, and preventing diseases at minimal costs. So before I invite my next speaker, give me 2 minutes to briefly explain lifestyle medicine. Presentation, please. So, what is lifestyle medicine? Lifestyle medicine is a medical specialty that uses therapeutic lifestyle interventions as a primary modality to treat chronic conditions, including but not limited to cardiovascular diseases, type 2 diabetes, and obesity. American College of Lifestyle Medicine. Next slide. Lifestyle medicine is an evidence-based discipline which aims to support patients to prevent, manage, and reverse certain chronic conditions using supported behavior change skills and techniques to create and sustain lifestyle changes. British Society of Lifestyle Medicine. Next slide, please. If you can't explain it simply, you don't understand it well enough. That's Albert Einstein. So let's just explain life first. What is life? Translation, he is the one who created death and life. in order to test which of you is best in deeds, and He is the Almighty, all-forgiving. But if we look at the highlighted, He created life. So obviously Allah created life. Life is the most precious gift given by Allah to us human beings. Your loved ones are a one-time chance, and you have no replacement. So once your loved ones are gone, they don't come back. And once you are gone, you don't come back for them as well. So saying that, living the most precious gift, how do we live it? Do we live it in the right way? Well, the way we choose to live life is through emotions, feelings, passions, pleasures. And all this is the way we choose to live. So, in other words, physically, mentally, and spiritually. And when we do it physically, we eat, drink, sleep, interact, act, work out. Mentally, we think, feel, emotions, passions, mindfulness, meaningful goals. And spiritually, gratitude, higher altruistic aims, values, serenity, tranquility, contentment. And when all of these combine together, we get lifestyle. And when health experts, through scientific ways and research, look into it and provide evidence, it becomes lifestyle medicine. And traditionally, it's just simple as forks, fingers, stress, feet, sleep, and love. That's 6 pillars of lifestyle medicine. Well, I tried to explain it more in an easy way, and I hope I could convey my message. We go on to the next speaker. She is a triple board certified in internal medicine, endocrinology and metabolism, and lifestyle medicine. The founder of Nurturing Our Health, an innovative clinic that integrates lifestyle medicine with endocrinology, focusing on the prevention and management of chronic diseases. As Vice President of Pakistan Association of Lifestyle Medicine and adjunct faculty at 𝗟𝗏 Institute of Lifestyle Medicine, she advocates for lifestyle medicine in healthcare and education. She is also committed to addressing physician health and burnout, regularly conducting workshops on self-care and workplace wellness. Ladies and gentlemen, it is my pleasure to invite Dr. 𝗟𝗏𝗶𝗰𝗲 to the stage, who will tell us about lifestyle medicine retreat themes and objectives. Dr. 𝗟𝗏𝗶𝗰𝗲.
Assalamu alaikum, everyone. First of all, thank you so much for coming. I don't have words to express my gratitude today. It means a lot given the situation in the city right now. Seeing all of you over here, मैं कहूँगी बहुत हौसला बन रहा है हम लोगों का. So I think I would skip first few slides. I just have 4 slides. But I think every year when we do this conference, we kind of recognize that we should talk about the basics. Like lifestyle medicine is the fundamental and basic of practicing medicine, but talking about lifestyle, definition of lifestyle medicine, and talking about the pillars of lifestyle medicine is also foundational. Sometimes when we talk about basic things, we feel like everybody knows it, but common sense is not that common. But I think thank you so much, Dr. Umar, for giving the overview of lifestyle medicine. I also wanted to go over the definition, which Dr. Umar has beautifully already stated. For the conventionally trained doctors, I think we get more comforted or at ease when we call something as a specialty. So let's call lifestyle medicine as a medical specialty. And that's how it has been, the movement has been introduced when it was first started by American College of Lifestyle Medicine. The most important thing was that here we talk about therapeutic lifestyle intervention as a primary modality. So it's therapeutic lifestyle intervention, it's prescriptive, and it is a primary modality that we're talking about. Most of us doctors haven't been trained in it much. And lifestyle medicine is about going back to the basics. It's evidence-based, it's whole person, finding the root cause. And the other buzzword that comes when we talk about lifestyle medicine is not only about the prevention and treatment of the disease, which we often talk about in community medicine and public health. We are also talking about reversing a disease, which when I was getting trained was almost a taboo to say diabetes can be reversed or hypertension can be reversed. It was something that we cannot even say that. Even I was looking back, and when I was looking at Mayo and Endocrine Society guidelines, initially they used to say diabetes can be treated but never be cured. The same goes for heart disease, for hypertension, for cancers, for autoimmune illnesses. Of course, we have to be very careful when we say this, and that's why we need a training of lifestyle medicine. The other important thing is to know the 6 pillars of lifestyle medicine, which includes nutrition, exercise, sleep, social connection, stress management, and addiction, avoidance of addiction. And my favorite is social connection, which we are having right now. I think I'll just skip the second slide. The conference theme, as we've already talked about, is Health Revolution, Lifestyle Medicine as your first choice of health. This resonated with us when we were deciding the theme because it's so basic, but I think probably this is my own struggle, because as soon as I hear about disease, I cannot go back to health. So this is a reminder for me that this is foundational. This is the first choice. We cannot talk about anything else before we talk about lifestyle or making a change in a whole person first. So the main objective of our conference is to raise awareness among people, to promote lifestyle medicine, its benefits in preventing, treating, and most obviously reversing chronic diseases. We are also encouraging integration and collaboration. So we have people from multidisciplinary areas like nutrition, physical therapists, behavioral therapists, psychologists, psychiatrists. So it's a teamwork, multidisciplinary teamwork. And the third thing is then adoption of this lifestyle medicine, the practice, and then taking it to health policy and, at a higher level. But the most important thing I would like to emphasize here is that these things are more for the doctors have to heal first. Every year, every passing year that I'm connecting to lifestyle medicine, I'm just focusing on myself that we need to heal first, or maybe in parallel with our patients, not thinking that our patients need healing, but also remembering that we need healing too. So it's a parallel process, and it cannot be one or the other. Thank you so much. I hope you enjoy the rest of the conference, and we'll move forward now. Thank you.
Thank you, Dr. Munira. Ladies and gentlemen, next joining us online is Dr. Beth Freites, a trailblazer in lifestyle medicine. Dr. Freites, MD, is an award-winning Harvard Medical School educator and a pioneer in lifestyle medicine. As the current president of American College of Lifestyle Medicine and chair 𝗖𝗓 Institute of Lifestyle Medicine, she has authored essential resources in the field, including the Lifestyle Medicine Handbook. Dr. Freites has created innovative wellness programs like Paving the Path to Wellness and continues to shape the future of lifestyle medicine education globally. We are honored to have Dr. Freites provide the opening remarks for our conference. Dr. Freites.
Hello, I am Dr. Beth Freites, president of the American College of Lifestyle Medicine and associate professor part-time at Harvard Medical School. It is such an honor and a delight to be part of this extremely important conference. 5th International Conference Lifestyle Medicine Retreat 2024 with the theme Health Revolution, Lifestyle Medicine as your first choice for health. I love that theme, and I wish you an incredible opportunity to learn, grow, and connect together during the days of this conference. I know you're having nutritious and delicious meals, inspiring and rejuvenating activities, and plethora of opportunities for networking, which are critical. So enjoy this conference, and thank you so much for letting me be a part of it.
Thank you, Dr. Fritz. Next, it is with great honor that I invite our next speaker to the stage, who also is the chairperson of this conference. And for all of us, she is our respected mentor as well. Dr. 𝗟𝗶𝗳𝗏𝗃𝗃, who is not just a leader in lifestyle medicine. She is a visionary who has redefined our approach to health and wellness. She has over 2 decades of experience in integrative health, combining conventional medicine with holistic healing practices. Her groundbreaking contributions have paved the way for transformative change, inspiring us all to elevate our practice and embrace a holistic approach to medicine. Her independent research called 𝗟𝗏, Synchronized Integrative Health Wellness Program for Everyone, has given her clarity about role of human behavior and biological circadian rhythm in prevention and reversal of disease. As the founder president of Pakistan Association of Lifestyle Medicine, director of 𝗟𝗏 Institute of Lifestyle Medicine, and CEO of Holistic Healthcare Solutions, she has transformed the lives of thousands through her lifestyle interventions and wellness programs. Dr. 𝗟𝗏𝗃𝗃 is also a prominent speaker and trainer advocating for the prevention and reversal of chronic diseases through sustainable lifestyle changes. I would invite Dr. 𝗟𝗏𝗃𝗃 to the stage to tell us about the evolution of 𝗟𝗏 Institute of Lifestyle Medicine and Pakistan Association of Lifestyle Medicine, a journey through the years. Thank you.
Bismillahirrahmanirrahim. Okay. Assalamu alaikum. And good morning to our overseas participants also. And I hope we have a lot of online participants as well. So, कौन कहता है कि ख्वाब नहीं पूरे होते? 3 साल से मैं कहती आ रही थी कि एक्सपीरियंशियल लाइफस्टाइल मेडिसिन कॉन्फ्रेंस करनी है, तो मैं लोगों की आंखों में पागलपन मेरे लिए देखती थी, तो मैं सोचती थी कि ये नहीं मेरी मदद कर सकते, तो फिर मैंने अकेले सोचना शुरू किया। और अभी बहुत अच्छी बात डॉक्टर उमर ज़फ़र ने कही थी कि यूनिवर्स आपके साथ आती है, और यूनिवर्स मेरे साथ आ गई, और वो यूनिवर्स जो मेरे साथ कल आई, वो कल तो नज़र आ गई सबको। कल जो कुछ हुआ आप लोगों को पता है कि आज हम और स्टोरीज शेयर करेंगे आपके साथ। दिस वाज इम्पॉसिबल कि ये लोग जैसे पहुँचे, इनको पहुँचाया गया है। तो आई एम हैप्पी। अगर आप में से कोई मेरे साथ नहीं है तो मेरे साथ डिवाइन सिस्टम है, मेरे साथ यूनिवर्स है, जिसने मुझे फैसिलिटेट किया इस रीट्रीट को ऑर्गेनाइज करने में। Retreat, I am always, I don't enjoy the medical conferences because the conferences are very boring. आप एक robotic way में जाके वहाँ बैठ जाते हैं और बस कुछ जो कुछ सुनते हैं वो बाहर जाके निकाल भी आते हैं, आपके अंदर कुछ नहीं जाता। So before I start, I would like you to stand up because we have been sitting for I think more than 30 minutes. So you can stand for a few minutes just to avoid the signs and symptoms of sitting disease. Yeah, it is sitting disease, and you might be knowing that sitting is called now the new smoking. So कुछ भी आप सोचें, आपका पैशन, आपकी नीयत अच्छी होनी चाहिए, मैंने ये सीखा है। आपके पास पैसे ना भी हों, आपके पास फंड्स ना भी हों, दो मैं इनका एहसान ज़िंदगी भर नहीं उतार सकूंगी हसन साहब का कि मेरी सपोर्ट इनकी हो। मैं उल्टी सीधी बातें करती हूँ, ये मुझे कहते हैं हो जाएगा, तो बस इनका ये कहना कि हो जाएगा मेरे लिए इससे बड़ी कोई ताकत नहीं है। आप सारे मुझे सपोर्ट ना करते ना करें, मुझे हसन साहब सपोर्ट करते हैं तो मैं उस ताकत पे चलती हूँ। आई एम एक्सट्रीमली ग्रेटफुल टू हिम एज वेल। रिगार्डिंग एवोल्यूशन, थोड़ी देर खड़े रहें, कोई बात नहीं कोई बात नहीं, कुछ नहीं होगा, नहीं नहीं कुछ नहीं, थोड़ी देर खड़े रहें, कुछ नहीं होगा। वो एक एंजाइम पैदा कराना है हमने आपके काफ मसल्स में, वो हो जाएगा उतनी देर में। सो जो एवोल्यूशन की बात है ना, एवोल्यूशन तो मेरा ख्याल है कि मैं आई एम वेरी पुअर इन डिफाइनिंग एंड एक्सप्लेनिंग जर्नी। जब मैं जाती हूँ तो बाद में मुझे लोग कहते हैं आपने ये भी नहीं बताया, आपने ये भी नहीं बताया, तो मैं वो भूल जाती हूँ। बिकॉज मेरा एम जो है, माई टारगेट इज नॉट अ फिक्स टारगेट। ये माइक आपका काम नहीं कर रहा शायद, हेलो, बैठ बैठ जाए प्लीज, बैठ जाए। या मेरा जो टारगेट है ना, देयर इज नो टारगेट, आई कांट से कि मैंने वो अचीव करना है। सो एवोल्यूशन फॉर मी व्हिच इज ऑनगोइंग, और अगली दफा आप कुछ और सुन रहे होंगे। So these are the from Rifa. My journey started in probably 15 saal pehle without realizing that I was into lifestyle medicine. So our journey with Rifa, it started in 2019. So 2020 was the year when we trained our master trainers. And then onwards, you can just go through the list. That first exam was in 2021. Then first time we introduced lifestyle medicine to the new batch of medical college. This happened in 2021. The first international virtual happiness summit. This was the time of COVID, so I organized this summit virtually. Then in 2022, we inculcated the undergrad curriculum. Then 2022, Vanguard Student Club, I started for self-care, and this we are continuing. We want to work on the self-care of a student. हम उस बच्चे को ट्रांसफॉर्म करने पे काम करना चाह रहे हैं ताकि उनकी लीडरशिप क्वालिटीज़ को हम यंग एज से, फर्स्ट ईयर से ही ठीक करना शुरू कर दें. And we have seen, I had never imagined that transformative characteristics are being evident in the personality. I never knew, because I thought transformation happens at the cellular level, but I never knew it can change your skin, it can change your खूबसूरती. वो बच्चियां खूबसूरत हो गई हैं, I never knew that. Na? So this happened in our Vanguard Students of Self-Care. Then in 2023, we have started 6 weeks course for the community. And then 2023, I started 3 months virtual lifestyle medicine internship. जो मेरे drugless clinic, I run a drugless clinic for the past 15 years, simply based on these practices, and we are reversing disease. मैं बहुत बड़ा claim कर रही हूँ, and it is happening. So many doctors are sitting here who are witness to the change because they attend my live clinic. They attend my live clinic. So मैं इनसे कुछ गलत बयानी भी नहीं कर सकती. Then Doha Declaration, which is part of our global collaboration, I got an honor that I represented Pakistan. There were 22 countries who participated in Doha Declaration, or Dr. Sohela is here. She will talk more about this. But I mean, the declaration was actually for the health of the Qatari people, but we all participated. Dr. Sohela will tell in a better way. So, and now the first ever experiential LM retreat. तो जागा में नहीं लग रहा मुझे. सोयावल लग रही है. So our master trainers, few visuals. इतना स्लो बार बार करना पड़ रहा है. ओ, ये आगे चला गया अब. चले. कहाँ है कंप्यूटर? उस तरफ करो, बंद करके करो. इट्स डिफिकल्ट. अच्छा चले, ठीक है. वहां से नहीं आप कर सकते? कर सकते? चलें. ये हमारे वही सर्टिफिकेशन थी, फर्स्ट बैच. दिस इज LMPC बैच ना, द सर्टिफिकेशन बैच. नेक्स्ट प्लीज. Actually, they were the ones who were our master trainers and LMPC badge. Next. Next. All our certifications program. Actually, this was the slide which I was looking for. पहला बैच था जहां हमने तमाम HODs को train किया था regarding lifestyle medicine. All, even surgeon, Dr. Danish, you can see, he is a surgeon. And the compliment was, he said, अगर lifestyle medicine उस वक्त आती जब मैं surgeon बना तो मैं lifestyle medicine expert होता, surgeon ना होता. Next, please. Sultan, you have done something technically to the slides. So we are currently running 9th batch of our postgraduate qualification. Next, please. First exam, Stefan, you can see Stefan. He travels globally. So for first exam, he has come to Pakistan. Next, please. Conferences, next, please. These are the various conferences. Next, please. This is a special slide because I wanted to pay a tribute to Dr. 𝗟𝗂𝗂𝗧, who passed away last week at the age of 103 years. Next, please. She was the one who reviewed my book, because when I wrote book, one of my professors, when I wanted to write book about what I was doing. So when I talked to one of my professor in Islamabad, he was definitely my professor also. He said, तुम जो बातें कर रही हो ये बातें तो हमें नहीं समझ आ रही, तो मैं तुम्हारी किताब कैसे रिव्यू करूं? He said कि नहीं, तुम्हें किसी ऐसे बंदे से बात करनी पड़ेगी कि जो इसके बारे में थोड़ा सा आइडिया रखते हो. Then something happened. Very unusual phenomena happened, and I was sitting next to Dr. 𝗟𝗂𝗂𝗧 in a conference in Chicago, and I got chance to meet her, and then I asked her, would you like to review my book? And then I sent her a few chapters. She said, tum shuru se bhejo chapters or end mein, and then she wrote a review. Aage dikhaye slide na. Next, please. I would like you to see these comments because she is not here. And I mean, she's no more on this planet now. So the book was written because of her guidance. So whenever you have dreams, Einstein ने कहा था कि अगर आप अपने बच्चों को जीनियस बनाना चाहते हैं तो उनको ख्वाब दिखाया करें. अगर आप उनको सुपर जीनियस बनाना चाहते हैं तो उनको और फैंटेसी वर्ल्ड में रखें. Because according to Einstein, at the level of there are dimensions. At sixth dimension is the zone where you can say where is the workshop of Allah Ta'ala. So sixth dimension को आलम लाहूत भी कहते हैं, वहां से चीजें नीचे आती हैं. तो Einstein talked about that dimension. So मैंने ख्वाब देखा और देखें अल्लाह ने किताब कहाँ से एंडोर्स करवाई. Next, please. So just to give you an idea, we have 42 IBLM certified doctors. We have 100 LMPC certified, which is a postgraduate qualification. Allied Health 46, and SWIPE internship certified about 29, and community certified people are about 66. This is a rough idea. We are not growing at a very fast pace, but the quality of people and the amount of imprinting, I always say it is not learning, it is imprinting. They have been transformed. If they would not have transformed, they would not have done what they have done yesterday. Next, please. Advocacy. Next, please. I get a lot of chance to go to different military schools. Even I have worked on that slide. I have, Army has invited to work on their champions. They were into some competition and I just have gone to train their athletes also. Next, please. So police, or I think every school of Pindi Islamabad, police school, I've been there. And the female police cadets, I enjoyed going and training them about their health. Next, please. Next, please. I think ye galat ho gayi. Next. These are the Happiness Summit. Happiness Summit is another very interesting avenue which we do online, but it is very popular here. Next, please. Next. This was a happiness gala last year in university also. No? Next, please. This is very, very dear to me because I enjoy working with students. So this is students. This is their vision and mission. Next, please. Just go through the slides. I just wanted to give you an idea. But the most rewarding recent program was for the employee health. Again, this was in my mind. Whenever I go to military schools, I always tell them कि आप officers और generals को लेके आते हैं, please अपने वो जो जिनको हम बैटमैन्स कहते हैं उन सारों को भी बुलाएं ना. तो फिर मैं उन सारे बैटमैन्स को बिठाती हूँ, उनकी बीवियों, बच्चों, उनके सबके मसले सुन के. The beauty of lifestyle medicine is it can cater a fakir, a beggar, and a king. So ये कोई मुझसे ना कहे या कोई ना सोचे भी नहीं कि लाइफस्टाइल मेडिसिन बहुत महंगी है. लाइफस्टाइल मेडिसिन जो आप कर रहे हैं उसी को सीधा करने का नाम है ना. सो दिस वाज एन इसका इतना हमें मजा आया. यहाँ पे एक दो लोग बैठे हुए भी हैं. हमने जब फॉलो अप लिया, बिकॉज मैं आई बिलीव इन टारगेट ओरिएंटेड थिंग्स, तो हमने जब फॉलो अप लिया तो हम हैरान हो गए कि पढ़े लिखे लोगों से ज्यादा जो हमें रिजल्ट्स मिले, डायबिटीज कंट्रोल हुई, नींद आना शुरू हो गई. अगर वो यहाँ बैठे हुए हैं, यहीं के हमारे ही एक हैं, वो कहने लगे कि 2 साल के बाद मुझे नींद आना शुरू हुई और मुझे पता चला कि ख्वाब भी आते हैं. आपसे भी मैं सॉरी, मैं थोड़ा सा टाइम आगे पीछे करूंगी, लेकिन ये मेहर हैं. आज ही सिर्फ शक्ल दिखा दें अपनी, बाद में आपसे लोग पूछेंगे. सो मेहर सेड कि मुझे तो ये पता ही नहीं था कि ख्वाब भी आते हैं. या आपने जितना सी हमारी वेरी मिनिमल इंटरवेंशन, सिर्फ इनके टाइम मैंने सीधे किए थे, कोई इनकी पॉकेट पे कोई बर्डन नहीं डाला था, और ये कहने लगे मुझे तो ख्वाबों वाली नींद आने लग गई है. सिमिलरली एक्सीलेंट रिस्पॉन्स फ्रॉम आवर peons and those who cannot afford anything, सिर्फ उनके टाइम ठीक किए थे. तो मुझे, मेरे लिए सबसे ज़्यादा रिवॉर्डिंग जो प्रोग्राम है वो एम्प्लॉय हेल्थ वेलनेस है. नेक्स्ट, आई थिंक वी आर डन. हाँ, सोशल मीडिया एडवोकेसी. नेक्स्ट प्लीज. आपको पता है कि सोशल मीडिया के थ्रू एडवोकेसी करना इज करंटली मोस्ट इफेक्टिव. So I learned about biohackers. So I repeatedly in my international conferences, I was exposed to a term biohacker. And initially I took this term in a very negative way. Biohacker का मतलब है कोई चीज आपकी कोई चोरी कर लेता है. But biohackers are the experts. I am repeating, biohackers are the experts who deliver a small piece of knowledge on social media carefully, very carefully. They talk about their, on the basis of their experience and definitely their qualifications, they deliver knowledge to the community, and they, in this way they are helping पता नहीं millions और कितने. So ये 4-5 लोग जो थे ना, पीछे वाली स्लाइड दोबारा, ये सारे जो कॉन्सेप्ट्स हैं ये बहुत मुझे क्वेश्चन किया जाता है इसके ऊपर ना. तो मैं भी बायो हैकर हूँ, मुझे पता चला बाद में. लेटर आई रियलाइज दैट आई एम अ बायो हैकर बिकॉज आई हैव बीन ऑन सोशल मीडिया फॉर पास्ट आई थिंक 12-15 years probably. So ये मैं आपको बताना चाहती थी, ये मुझे अभी कल पता चला है कि मैं भी एक बायोहैकर हूँ, तो मैं भी बायोहैकर हूँ, and I am playing a role for community through social media. Next. बस ये हमारा सेकंड बैच था इंटर्नशिप का जो हम वर्चुअली लेते हैं, ये अभी 2-4 दिन पहले खत्म हुआ है. नेक्स्ट प्लीज. या दिस इज अनदर बहुत इंपॉर्टेंट ग्लोबल कोलैबोरेशन, दोहा डिक्लेरेशन. नेक्स्ट प्लीज. So PALM is part of LMGA, which is Lifestyle Medicine Global Alliance. So PALM represents Pakistan in this body. Then PALM is part of Asian Lifestyle Medicine Conference, and they'll be, there is a plenary session by the Asian Council after the lunch also. Then we are part of Global Positive Health Institute, IBLM. We are partnered with IBLM also, which is International Board of Lifestyle Medicine. And we are part of Doha Declaration, and very energizing and very, I mean, we don't have words. When we were together in that event, we don't have words. So the beauty of lifestyle medicine is it happens at subtle level. It connects you. So when we were, so Hela knows that when we were there, we were from different backgrounds, but we were like we were one family. So lifestyle medicine, the passion, the intention, it connects you wherever you are. We have a language. Jasdeep, our proctor, he said, you are understanding my language. So lifestyle medicine has a language. So we all can understand. Even if you don't speak, we understand what do you want to say. Next, please. So these are the few pictures. Next. Next. These are the few articles which are purely related to what I am doing. So I'm not good at doing or conducting researches, but I have a lot of clinical data. So my team is doing this, and I think in last 1 year, we have done these different researches. Next, please. Do iski slides hongi. Next. This is an interesting quote. So thank you very much. And I hope you will enjoy the whole conference and don't miss the dinner part. Thank you.
Thank you very much, ma'am. And I will mislead them, and I will arouse in them sinful desires, and I will command them so they will slit the ears of cattle, and I will command them so they will change the creation of Allah. And whoever takes Satan as an ally instead of Allah has certainly sustained a clear loss. Next slide. Satan said, "Because you have put me in error, I will surely sit in wait for them on your straight path. Then I will come to them from before them and from behind them, and on their right and on their left, and you will not find most of them grateful to you." The first verse from Surah Al-Nisa, ayat number 119, highlights how Satan entices mankind to corrupt and alter the natural order of Allah's creation, both physically and morally. The phrase "change the creation of Allah" could extend to altering healthy, natural lifestyles leading to destructive behavior. In the next two verses from Surah Al-Araf, ayat number 16 and 17, Satan acknowledges his intention to mislead humanity from the straight path set by Allah. His plan is to divert them from their natural disposition, fitrah, of living according to divine guidance. Lifestyle medicine, obviously, as the verses say, Satan is there to mislead us. So lifestyle medicine needs leadership as well. To discuss this further, I would like to invite the next speaker to the stage. Our next speaker is Professor Anice Ahmed, a distinguished social scientist and meritorious professor, a leading scholar in Islamic thought and jurisprudence. He is the founding Vice Chancellor of Rifa International University and has been honored with 𝗟𝗶𝗳𝗲𝗏𝗍𝗂. As Chairman of National Rahmatulil-Alameen Authority, Professor Anice continues to contribute to socio-political and educational thought with over 90 research publications to his name. No one other than Professor Anice would be suitable to tell us about the role of leadership in lifestyle movement. Sir, kindly enlighten us with your thoughts. Thank you.
Thank you. Bismillah ar-Rahman ar-Rahim. Alhamdulillah wa salatu wa salam ala khatamil anbiya. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. I'm thankful to Allah subhanahu wa ta'ala for blessing Rifa and particularly gifting us with an extremely energetic thinking about future and always meeting the KPIs of the conference, Dr. 𝗟𝗶𝗳𝗏𝗏𝗍𝗶 and her team. I'm also thankful to the Chancellor who has always been supportive in these matters. The topic was selected by Dr. 𝗟𝗶𝗳𝗏𝗍𝗶, and so I'm just trying to think loudly on a few aspects. When we talk about leadership, the conventional approach is in front of you, first and foremost, driven by position, hierarchy-based, dominating. Second type is usually knowledge-based with expertise. And third type, charismatic, inspirational. But at the same time, there are others who think differently. And that gives you an idea about the difference between conventional approach and what Islam has taught us. Islamic approach is summarized in these 10 very simple characters: integrity, competence, vision, courage, holistic justice, pragmatic decisions, servant leadership, not trying to dominate, practical wisdom, resilience, compassion, and spiritual intelligence. This is how Nabil defines leadership. My own understanding developed when I went through Daniel Goleman's book, Social Intelligence and Emotional Intelligence. And there I found the psychiatrist and expert of psychology coming up with how our emotions and cognitive aspects work together. But that led me to a next dimension, which I believe is what is Quranic intent. And that is neither emotional dimension, non-cognitive dimension, but ethical dimension, which I call ethical intelligence. Ethical intelligence precedes both the working of amygdala and neocortex. And therefore, this is the basis of my whole discussion. In this, I understand that intelligence-based leadership or inspired by emotional intelligence, it is holistic and unified and integrated. Spiritual intelligence may have elements of subjectivity, while ethical intelligence is more objective, measurable, and replicable. Emotional intelligence and spiritual intelligence both have great content of subjectivity, and we cannot generalize that. You cannot experience my spirituality, nor I can yours. But at the same time, if you find a different dimension, which is global ethical values, which are not confined to a region or a people. I always say Islamic ethics and Quranic ethics is not a development of Arabian mind, not a development of Semitic mind, but a matter of divine intervention to transform social constructs, divine intervention to change social norms and values. And therefore, Islamic ethics has a universal dimension. The whole so-called Western, Eastern ethics is situational. The customs and traditions of Japan and China and Sri Lanka are different. In one place you bow down, other place you kiss a hand, a third place you keep a distance and just say hello. And all those are ethical ways. But what across the border, across the humanity takes place is Islamic ethical values which are universal. And that makes impact on leadership. So my concern this morning is how this ethical leadership can play a role, because it is inspired by ethical intelligence and not by just emotional or cognitive intelligence. In that respect, ethical intelligence synergizes cognitive as well as emotional dimensions of human behavior. It represents a model of leadership of soft transformatory behavioral change. You can bring a change with fear, with authority, with command, but that's not coming from inside. It's not transformatory. It's imposed. But transformatory means when it grows from inside. And that is only with a long-term, continuous effort known by the Quran as istiqamah and sabr, which is the most difficult area for leadership. Leadership quite often wants to have immediate results, and therefore they always go for methodologies which ultimately create an impact. On the other hand, the Quranic approach is that of sustained effort, persistent, and effort with complete dependence of Allah subhanahu wa ta'ala. Therefore, leadership, in my understanding, has to be soft, transformatory, and for behavioral change. Now, how that takes place, it is inspired by ethical intelligence, is expected to have following characteristics. And I have reduced from 11 to just 7. First and foremost, critical thinking, which the Quran calls tafaqquh fi din. The word fiqh we use is driven from their Quranic ayah, لِيَتَفَقَّهُ فِي الدِّينِ. And that means not only studying Quran and Hadith, but deen means studying human body, nature, human problems, economy, society, everything. Therefore, tafaqquh is not a matter of nikah and talaq and matters of dealing with ibadat. Similarly, it has to be innovative. Unfortunately, we have confined the meaning of ijtihad to breaking away from tradition. And that's completely wrong. Ijtihad essentially means that sustained effort where, keeping in view the overall objectives of Islam, new ways and methods are discovered. And it's not confined to so-called Sharia matters. Sharia envelops every single aspect of life. Technology, IT, AI, everything is to be addressed from that perspective. Thirdly is satisfaction of heart, shara of sadr. You may meet a person, enjoy his presence, but you may not feel from inside that he is near you. But you may meet a person on very first sight, you may develop confidence. That's your shara of sadr. So leadership, unless it has all these aspects, will not be able to create a transformatory process. Next is balance and moderation. Leadership has always a tendency to exceed, go to one extreme or the other. It has to be balanced and moderate. That's why if we look into Quran and Sunnah, two basic concepts, Tawheed and Adl, they are the basis of every other activity of human being. If we either deviate from Tawheed, which means integration of personality, which means unified thinking, which means accepting only Allah subhanahu wa ta'ala as ultimate guide. And secondly, blending it with adl, balance and moderation. Next is truthfulness, which combines two aspects, sidq and sincerity or ikhlas. A leadership which has two different faces can never succeed. Leadership has to have one single aspect, and that too has to be near to truthfulness. And then excellence, mediocre leadership cannot work. Leadership has to be excellent. And lastly, it must have compassion. It took us a long time to think, and perhaps we are the only university in Pakistan, perhaps in Muslim world as well, where we came up with our 6 ethical values of the university. The first one is al-akhirah, that our thinking should be futuristic. Al-akhirah is not just a matter of Jannah and Jahannam, but it simply means think of future in this world and life hereafter. The second one is that of mushawara, that matters must be decided with continuous ongoing process of discussion. And that mushawara leads to ownership. Third is ijtimaiyya, that you must develop a collective approach. And fourth is that you must have the concept of what you call accountability, ihtisab. And similarly, the value of itqan, excellence. So we have defined our university's objectives in terms of those 6 values. Having said that, the Quranic view of human well-being and conduct and behavior is essentially a matter of iman, which we call usually faith, which comes from the root word amana, meaning be safe and not exposed to danger. Faith bestows peace and safety. Islam literally means to submit, root words sin, lam, mim, to be safe, to be whole and integer, not disintegrate, accepting divine laws which the whole universe has accepted. And lastly, taqwa, which is Allah consciousness, the root word waqaya, meaning protection from getting towards wrong or difficulties and disintegration. To summarize, nurturing of a balanced personality with synergy between physical, mental, ethical, spiritual, and social needs. I have added social in whatever we have the concept of welfare. It stops down mostly at spiritual. But Islam makes itself unique in the sense of spirituality has to be followed by social involvement. Therefore, Masale Mursala, the needs of society and community are the basis. And no spirituality can work without coming up with social impact. Therefore, these are the natural outcomes which lead, and that's how holistic health needs to be understood. It should not stop simply on physical, mental, ethical, spiritual, but should also have a dimension of social which has to be given proper importance. It was due to this fact that we perhaps is the only university in this country. We have introduced a required course for our students, which we call Family in 21st Century. In 7th semester, they have to go through a course which gives them idea about value of family, society, and their role. And unless universities play that role of social change, they will not add to even the web of knowledge. Web of knowledge will be partial without having all these 5 different aspects. May Allah bless you all. Thank you very much.
Thank you very much, sir, for enlightening us with such a rich talk on leadership. Obviously, and definitely, we need leadership to carry on lifestyle medicine. When Professor Sir Allama Iqbal presented his shikwa to Allah subhanahu wa ta'ala, saying, रहमतें हैं तेरी अगयार के काशानों पर, बर्क गिरती है तो बेचारे मुसलमानों पर. So the reply came with a formula for success, which if followed can be the key to a legendary lifestyle. And I'm sure all of you know that formula. It just has to be applied, which is very simple, saying, कि मोहम्मद से वफा तूने तो हम तेरे हैं, ये जहां चीज है क्या, लौह कलम तेरे हैं. So simple, yet for us it's complicated. Right, we move on, but we'll just go back a few years. It's the year 2020, and it's March 2020, and I'm sitting in UK in my house in a room where I'm thinking, I really want to see tomorrow. But hopes were dwindling day by day. If ever the world would see another tomorrow. So I sat there and wrote a few lines. Obviously, didn't have anything else to do. And that said, I want to see tomorrow. I want my streets deserted today so I can see my friends and family driving happily tomorrow. I want my parks and playgrounds empty today so I can see my kids play in them tomorrow. I want my restaurants closed today so I can eat in them tomorrow. I want my malls to shut today so I can shop in them tomorrow. I want the weddings and fun gatherings postponed today so I can sit in those happy gatherings tomorrow. I want my institutions and offices to close today so I can see a rising and shining generation tomorrow. I want to isolate myself inside today so I can see a bright, blue, and healthy sky tomorrow. And above all, if I could, I would stop time for all of us today except for Corona and let it die in the streets by all of us staying at home to see each other with lots of hugs tomorrow. So, thank you. Whilst I was sitting in a room writing these words, there were people who were working to keep our hopes alive. They were working day and night so we can see another tomorrow with our kids. Our next speaker, though Allah has given him great success, is a living example of such heroes. When Pakistan, like the rest of the world, was suffering with COVID pandemic, he was leading the way to keep our hopes alive to see another day. He is a global health expert with 35 years of experience spanning international roles at WHO, the public, private, and non-profit sectors. Served as a special assistant to the Prime Minister on Health, leading Pakistan's COVID-19 response and extending health insurance to marginalized groups. Currently a professor at 𝗟𝗶𝗳𝗲𝗏𝗃 University, he is establishing a school of universal health coverage and has made key contributions to health policy, including essential medicines, UHC, and pharmaceutical regulations. His work spans over 75 countries with numerous national and international publications. We are fortunate to have amongst us Dr. Zafar Mirza as our honorable chief guest for today's session. I would like to invite Dr. Zafar Mirza to come to the stage and tell us about health system and lifestyle medicine.
Bismillah ar-Rahman ar-Rahim. First of all, thank you very much for such a long, undeserving and kind introduction. Chancellor Sahab, Vice Chancellor Sahab, members of faculty, students, ladies and gentlemen, I will talk about a larger context within which we should be appreciating lifestyle medicine. I will not be talking technically about lifestyle medicine because you have enough, you have heard enough, you have enough specialists on this specialization, but I will try to position lifestyle medicine in the larger context of our healthcare systems and our life at large. So why I thought that I should pick this topic is important for this reason. Can I have my next slide? We can see reality in very patchwork way, and we think what we are seeing is a reality. Whereas unless we see the bigger picture, we do not understand the larger reality. I say this with respect to different specializations which develop, and this is the nature of knowledge. It specializes and it equips us with those skills and those understandings which can benefit humanity. But from time to time, it is also very important to bring back the larger perspective. Because otherwise, we can become such super specialists in one super specialty that we, on a lighter note, I will tell you that two surgeons were discussing the new technique of putting sutures, and they were congratulating each other after the surgery. And they were saying that What a marvelous technique that we have found. And the nurse came and she said that that patient has died. And they said, that's okay, but what a great technique that we have come up with. So it's very important to see the whole elephant, not just in pieces. That sets the context for the rest of everything that I will say today. Next, please. First of all, I want you to understand that where we stand today in Pakistan with reference to our health conditions. On one slide, it cannot be captured, but it will still give you some very basic understanding of the tragedy that we live in. And this will also make us think that how we, who are very passionate about benefiting humanity, what is our role and where we come in. We are in a serious public health crisis in Pakistan. There is no other way of characterizing the situation than calling it a crisis. Our population is growing like, I mean, it's not a good expression, but I have to use it. We are growing like rabbits. 3.6 total fertility rate, 2.5 population growth rate are one of the highest in Asia right now. If we look at and divide, and this is how the burden of disease usually these days is understood in these 4 groups: mother and child care, non-communicable diseases, communicable diseases, and some people differentiate between mental health and non-communicable diseases. We are doing very badly in each one of them. For example, we have second highest new mortality rate in the world today. We have not been able to eradicate polio, and it is again on the surge. Until yesterday, we had new 28 cases of polio, which are crippling our children. Out of 194 United Nations member states, there are 2 nation states who have not been able to eradicate it: we and Afghanistan. We are not being able to immunize our children, a quarter of them, with routine immunization. This is very serious. This tells us that how much we are failing to serve our people with the essential health care, which is their right. And when I say that 75% is the best estimate of immunization in Pakistan, if you go one layer down and we compare different parts of Pakistan with reference to immunization, it is startling. And it should make us very worried. In Islamabad and in Punjab, the immunization rates against 10 diseases for children is up to 90%. In Balochistan, it is 40%. In Pashin, in Bolan, in South Waziristan, it is only 20%. Meaning that we are failing to immunize our own children, 80% of them in some districts of Pakistan. We have highest prevalence of hepatitis C. Every 4th adult, and this is getting closer to lifestyle medicine now, every 4th adult above the age of 20 years is suffering from diabetes type 2. Every 4th adult above the age of 20 years. Every 3rd adult above the age of 45 years is suffering from high blood pressure. Every fourth woman who goes under childbirth also goes through perinatal depression, 90% or more than 90% of which remains unrecognized, what to talk about its treatment. And every fourth child at primary level in our schools suffers from some kind of emotional or behavioral problem. And these are those lucky children who go to school. We have 2,60,00,000 बच्चे in Pakistan who are out of school. So that's the larger context I'm talking about, within which we have to see all of us, ourselves, with respect to our work, our expertise, our specialities, that what role we should play in healthcare system of Pakistan. It's very sobering. Sorry to make you feel sad, but that's a reality. Next, please. Sorry, go back once. And the greatest of all the tragedies is that all these problems and many other problems that I have not talked about are all preventable. All preventable. So in other words, what we can also say is that it's a man-made tragedy. Because if we decided, as many other nation states, we could have overcome these problems and our people would have not suffered with these problems. So this is a man-made disaster. Next. We have heard about lifestyle medicine. I will not repeat everything. I just wanted to be on the same page with people who know more about lifestyle medicine, so that I'm not diverging in some other direction. But if I have next slide, I pick few keywords in this. Next slide, please. Go back. And I will also try to flag few of my own thoughts on some of the keywords which have been mentioned and some of the key concepts which are being followed in pursuing lifestyle medicine. The first word is medical specialty. Whereas we take pride in specializations and expertise which goes with it, to me, I think that calling lifestyle medicine a specialty is limiting it, because it should be the way of life. It should be the cutting across theme in our healthcare. By limiting it to a specialty, we will also confine it in terms of its institutionalization and its trainings and its expansion. Something to think about. Secondly, I also take an exception to the word therapeutic lifestyle interventions. The word therapeutic also invokes the meaning of curative. Whereas to me, lifestyle medicine is more preventive than curative. So I would also urge that we also think about it in a broader meaning of healthy life, promoting healthy lifestyles, rather than limiting it to therapeutics or to the curative dimension of medicine. I can understand this because we come with particular trainings ourselves, and I really like this expression somebody mentioned, healing the doctors first. We also need conceptual clarities and transcending our roles which are confined by a particular kind of training that we receive ourselves. So we are hostage to our own upbringing, if you like. And I invite all of you also to transcend from curative model, therapeutic model, to a more holistic, preventive, promotive, rehabilitative, and even palliative healthcare. Next. Sorry, go back. यार ये आप मेरे हाथ में दे देते तो मैं खुद ही इसको कर लेता. किधर है? ओके जी जी, थैंक यू. Again, we also tend to limit lifestyle medicine to chronic diseases, and by chronic diseases we mean most of the times non-communicable diseases. To me, again, it is limiting something very useful, very wholesome, with a very broader application in our lives just to chronic diseases. I think this should be cutting across overarching dimension of our healthcare. The rest is fine. I think I will just stop here by giving some of my own thoughts about the conceptual underpinnings which lead us to pursue lifestyle medicine. Okay, with this prelude, this was just a teaser. I now come to my presentation. I will very quickly run through a few of the slides that I have to share, not give. Who am I to give to such learned people anything new, but just to share my thinking about what health system is and should be, why universal health coverage is important with reference to the earlier tragedy that I shared with you, and how lifestyle medicine can be integrated into a larger health system and should become a component, an integral component of universal health coverage. So these 6 pillars, okay, yeah, I'm trying to work it out. अच्छा ये reverse में चलता है. So we will first talk about health system. What is health system? And why lifestyle medicine has to grow within a health system. It cannot be an isolation. It cannot be an isolated phenomenon. But health system has to be started with the health itself. What is health? So health in 1948, when the constitution of the World Health Organization was being set up, was defined as such, and it resonates with the 21st century movement of the lifestyle medicine. Health is a state of complete physical, mental, and social well-being, and not just absence of disease. That's very important, and that's very interesting. बीमार ना होने का ये मतलब नहीं है कि आप सेहतमंद हैं. And as Dr. 𝗟𝗍𝗳 was mentioning, later people have also, especially in Muslim world, have added the word spiritual to it. So it's physical, mental, spiritual, and social well-being of the person. And it's not just that you are diseased. In 2007, there was a major effort in World Health Organization to define health system. And a publication was produced, Everybody's Business, Strengthening Health Systems for Better Health Outcomes. And it was defined as a system that consists of all organizations, people, and actions whose primary intent is to promote, restore, and maintain health. Promote, restore, and maintain health. Each word in this is very significant. I'll spare you with the lower part, but what is important here is that health system is a is everything that we do in society to promote, restore, or maintain health. There is no distinction of public sector and the private sector. There is no distinction of prevention or curative or being rehabilitative. There is no distinction of between primary healthcare and tertiary healthcare. Everything, every organization and effort which is to promote, restore, and maintain health is a health system. Of course, it is very difficult to comprehend it, but we will see that if we go closer to it, what health systems are made up of. There are 6 building blocks which are considered as the building blocks of any health system anywhere in the world. There are health services which we need to deliver. There is a health for workforce, doctors, nurses, and paramedics. We need health information. We need medical products and health technology and devices. And we need money to run those healthcare systems. And of course, we need governance. So these are some of the most important, the most shortlisted list of the building blocks of any health system. Now, when I will talk about all these things, in the back of your minds, you should continue to think that how lifestyle medicine should relate with each one of these building blocks. If these building blocks are working in sync with each other, and if we are concerned about improving access, quality, and safety of what we deliver to people, then we can think about, at societal level, improved health. Then we can claim that your health systems are responsive to your needs. So this much about health system. Universal health coverage. This is also a concept and a construct which people very loosely use without fully appreciating it and fully understanding it. I thought it's a warning to me. Okay. Universal health coverage. I'll spare you with this. This is the history of how the concept has developed since especially 1948, when the human right to health was enshrined in the Constitution of the World Health Organization. And until today, 133 countries in the world have actually incorporated right to health in their national constitutions. Unfortunately, Pakistan is not one of those countries which have right to health in its constitution. Leapfrogging in 2015, Sustainable Development Agenda came, and it actually included a target on universal health coverage. The third Sustainable Development Goal is about health, and one of the targets, 3.8 in SDG 3, deals with universal health coverage, and it calls for achieving universal health coverage, including financial risk protection, about which I will talk in a minute, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines to all. This is the definition, a very loaded definition of universal health coverage by WHO, meaning when all people and communities can use promotive, 5 kinds of services: promotive, preventive, curative, rehabilitative, and palliative health services they need of sufficient quality to be effective, while also ensuring that the use of these services does not expose the people to financial hardship. Again, each word, each sentence in this is very, very important and leads us to think in different directions. which when come together formulate the concept of universal health coverage. Graphically understanding this is like this shell and the cube. The outer shell is the total population or a whole of society, and the inner cube is people in 3 axes having our coverage of health services, have financial protection, and the percentage of population which is covered. When countries pursue universal health coverage, actually they are pursuing the enlargement of the inner cube to fill this shell. If you know what I mean. If this cube will grow, it will fill the outer shell, and then we will say that in all 3 dimensions of universal health coverage, we have achieved for everybody a decent health care. There is also a theory of change that how societies achieve universal health coverage. And this theory of change is by realigning and strengthening your healthcare system, which I earlier defined to you, moving in the direction of covering every person, regardless of any distinction, providing them essential package of health services and providing them financial protection when they need it, and ensuring the quality of what you are providing them will only ensure universal health coverage. So the whole of the healthcare system has to be redesigned, realigned, and reoriented towards the targets of universal health coverage. And once you achieve universal health coverage, then health is a precondition to the whole of sustainable development. A sick child cannot even go to school. So health comes even before education. When people get sick, they become poor. And poverty leads to further ill health. There is a vicious circle relationship between health and poverty. So the first SDG, eliminating poverty, is not possible if people are not healthy enough. So on and so forth. Number of SDGs are dependent on healthy populations. Now, in a healthcare system, whatever we do, it all ultimately manifests itself in the form of health services. All financing, all medicines, all health workforce and their education ultimately is done to deliver some kind of health services to the people. So we need to understand the concept of health services. And there is embedded the lifestyle medicine and the services that you will provide to the people in the name of lifestyle medicine as part of health services. So, how we should integrate lifestyle medicine into the health system? As I was talking about, So, I personally think there are 3 ways in which, 3 main avenues through which lifestyle medicine should become part of the healthcare system. First is that it should be delivered along with routine services in healthcare system. If you try to organize a separate Ministry of Health for lifestyle medicine, it will not work. It has to be integrated with the existing healthcare system and the healthcare delivery system. How? I will talk in a minute about it. Then it should be integrated with the medical education and training so that our health workforce, by the time they are ready to serve people, are already oriented enough with lifestyle medicine. And thirdly, we also need to think about intersectoral collaboration, and I'll come to that in a minute. Can I have some water, please? And sorry if I'm taking too much time, but I thought this is my opportunity to talk about, thank you, sir, talk about, as a student of health systems and universal health coverage, to, thank you, बहुत शुक्रिया, बहुत शुक्रिया. To help position something so important in the larger context. So, how we should integrate health services at the primary healthcare level, and why I say at primary healthcare level, I will also explain. The health service coverage, health service research now informs us that there are basically 5 kinds of health services, as earlier mentioned, and there are 5 levels of services, or we also call them delivery platforms. Community level, first level primary healthcare facility, first level hospital, tertiary level, and population level. When I explain this to people, people immediately ask me, sir, what is the difference between community and population? So community is when a health worker enters a household individually. So in case of Pakistan, our lady health workers, when they knock at the door of a household, that is community level. And population level and services at the population level are those which are actually implemented for the mass education and behavior change. Smoking kills. You should protect yourself from polluted air. Unsafe food is not good, etc., etc. Media campaigns which address population at large are the population level, and what we do there are also health services. So if these are, I call it 5 by 5. So 5 kinds of services at 5 level of healthcare. Now, health service research also informs us that 70% of essential health services can be provided at 2 delivery platforms: community health level and the first level primary healthcare facility, which in our case in public sector means lady health workers and BHUs and RHCs. In private sector, it means GPs and outpatient departments of the private hospitals, where people, instead of taking tertiary care, come for basically primary health care. And that's why our hospitals are overcrowded, because our first level primary healthcare facilities are not working. So when people do not get service there, they crowd the tertiary level hospitals, but actually they are coming there for primary healthcare. Now, without taking you too much into it, the global evidence by disease control priorities over last 25 years informs us that in low and middle income countries, if governments can provide 218 health services to the population, more than 95% of the burden of disease can be effectively addressed. I repeat this because this is very important. 218 by name health services, which are a combination of those 5 kinds of services: preventive, promotive, rehabilitative, palliative, and curative. If those services a government can provide reliably quality services to the whole of population, your population will be healthy. Many of those things that you talk about in lifestyle medicine are part of these 218 services, which you might not know. And if you are really poor, if you are poorest of the poor nations, pick at least 104 highest priority health services, for God's sake, from these 218 health services, and you can still manage very well. And intersectoral services, I'll skip for a minute, I'll come back to it. Pakistan, on the basis of this global evidence, has developed an essential package of health services in order to achieve universal health coverage. Instead of those 218 and 104, keeping in view our burden of disease and our health conditions and our financial situation, we are saying that there are 28 health services which must be provided at the community level. There are 43 health services which must be provided at the first level primary healthcare facility. And there are 45 services which should be provided at the first level hospital. In a district, it would mean a Tehsil headquarter hospital in our context in public sector. In total, we are talking about 117 in total, and at district level, it's only 88 health services. Now, when I present this scheme of thinking with people working in different specialities, it is new to them. It is new to them because they have never been taught about it. When we were in medical colleges, when I graduated, I have no idea that how healthcare system of Pakistan is organized, what are our burden of disease, how to address this burden of disease, what is our national health policy, what is our human resource policy, what we are spending on health as a government. Those basic elements for which we actually need our health workforce to address, they are completely ignorant about it. And those of us who then become specialists out of that lot also have no idea. I'm sorry to say this. We have no idea. And in whichever specialty we are working, we think that by focusing and improving within that specialty, we will address the problems of healthcare in Pakistan. We will never be able to do that. Sorry if you find me little provocative on this. I have to be, because I am honest and I have to be candid, because I care about the healthcare of the people of Pakistan. Now, these 6 pillars of the lifestyle medicine, many of them are already one way or the other have been shortlisted while we were developing. When I say we, when I was in the ministry, I actually accelerated this process because it is so fundamental to first define your burden of disease and then design and select your health services which are needed to address that burden of disease. So this is all a work which took place along with COVID between 2018 to 2021. So we have now this national package. It is downloadable. I can send you the whole document. You can distribute to all the participants. We should be familiar about it. And as I was saying, all these 6 pillars in one way or the other are already part of this package. The question is that how the specialists, with in quotes, the specialists of lifestyle medicine would play their role in the delivery of those services which are related with these 6 pillars to the common people of Pakistan as part of healthcare system. And I have actually tried to provide some screenshots to you from this package of those services which are related to non-communicable diseases. I will not read through them, but you will have the presentation and you can go through those. And you can actually mark those which are related with these 6 pillars. And those, if they are absent, that's where the intervention at policy level will come in from people who are working on lifestyle medicine to get them included by providing evidence that why it is important. And now, briefly, I will talk about integration of medical education and training. First of all, I think that we are not training our, as I was earlier saying, an average graduate from any medical college have any idea about not trained in primary health care. It is absolutely possible, and you will agree with me, many of you, that when we graduated, or any fresh graduate when has completed his or her, I should say her and his, because there are more women now. When they have completed their house job, it is possible that if they come themselves from urban background, they have never set a foot in any primary healthcare facility in the last 6 years of their education and training. Isn't it right? I had not done that when I graduated. So what do you expect from our doctors to serve at a level where 70% of essential healthcare can be provided? What role they will be playing? And why they should be going there in the first place when they have no incentive, no training, no backup support? So PMDC has now actually made it mandatory to introduce family medicine at undergraduate level. And family medicine should be integrated within the family medicine. It has to be, because otherwise family medicine has no meaning. But also, I started this work when I was Minister of Health, but then COVID took over, and I went back now as a citizen with no office, no authority, but I just one day called PMDC, and I went there. They were nice to offer me a cup of tea, and I sat down with them, and I explained exactly the way I have explained to you, that you are the regulator of medical education and medical practice in Pakistan. Do you know? And I asked the president, had you gone to primary healthcare center while you graduated? And his answer was no. So, to cut a long story short, I have worked with them, and PMDC has now made a decision that every existing and new medical college in Pakistan, or dentist college in Pakistan, there are about 185 of them right now, along with establishing a 400-bedded tertiary level hospital, they will also have to establish for at least 5 teaching quality primary healthcare facilities where their students who will be learning family medicine go there for hands-on training in those primary healthcare facilities to learn about how to deliver quality primary healthcare and essential healthcare at community level to our people. This has happened. This has not only happened, but those of you who are responsible for medical colleges know that you have received these letters from PMDC. Somewhere behind this policy, I have played a little role, but Alhamdulillah, this was so common sense that people understood it, and now medical colleges are reorganizing themselves that how they can actually establish education and training of primary health care to their medical students. So at least our future generations of our health workforce, especially doctors, are more oriented towards what is needed and what is expected out of them. But also, I think doctors also need to have some humility. When we say health workforce, they always think it's we. So you are talking about doctors. No. I'm not talking just about doctors. It's nurses, it's paramedics. There are 30 different kinds of specialities in paramedics. 30. None of them are being taught in primary healthcare currently. We have to reorient the whole health workforce, not just doctors, to be able to address primary healthcare needs of the country. Last but not the least, intersectoral collaboration. ये भी बहुत important है. इसलिए कि we can do certain things which we are not doing by remaining within our healthcare system, but we also have to transcend our healthcare system to reach out to sector of education, to sector of transportation, ministries of environment, and whatnot. And when I tried to look at these 6 pillars where intersectoral collaboration is needed, I could at least come out with 3. There may be more, but this is just to give you a taste. Healthy eating. You cannot achieve your goals if you do not change the food industry and the food chain in this country. You have to work with ministries of food and agriculture, you have to work with ministries of education, and you have to work with media to promote healthy life, healthy food, and the lifestyle associated with it. Exercise. You have to work with, like I was very heartened to know that Dr. 𝗟𝗶𝗳𝗲𝗏 is working with different employees and different organizations in armed forces, etc. This is very, very important. The sedentary ways of life are one of the, as you were saying, what? It is a new smoking, sitting disease, sitting syndrome maybe. And our educational institutions. And the third one, minimizing risky substances. Again, Ministry of Industry, Ministry of Environment, media. If we do not reach out to them, change their policies, make them understand that what implications their policies would have on the health of the people, we would not achieve even if we have enough knowledge about them. So to me, to conclude, lifestyle medicine, I have to rethink about it, that do I want to call it a specialty or do I want to call it medicine? It is medicine. It is cross-cutting. It should be overarching. And not only that it is not a specialty, but it should be a movement, actually, which should cut across everything we do in the name of healthcare in Pakistan and elsewhere. And we have to mainstream it in our healthcare system. And thank you very much. And sorry for long talk.
Thank you very much, sir, for such an informative and enlightening talk. I think, I don't know about you people, but I was sitting for a long time, and I think it's time for an activity boost, for which I'll ask Dr. 𝗟𝗶𝗳𝗏𝗏 to come to a stage and take us through an activity boost with another guest who has been with us today. So Dr. 𝗟𝗶𝗃𝗏𝗏, please.
जी अस्सलाम वालेकुम अगेन। सबसे पहले तो मैं डॉक्टर ज़फ़र मिर्ज़ा साहब का बहुत बहुत शुक्रिया अदा करना चाहूँगी। आपकी बातों से बहुत ताकत भी मिली और आपकी बातों से बहुत डिप्रेशन भी हुआ ना, बहुत तकलीफ़ हुई, क्योंकि जो आपने फैक्ट्स डिस्कस किए वो हमें नहीं पता थे और हम सब जो डॉक्टर्स हैं जो अपनी तरफ से बहुत काम करने की कोशिश कर रहे हैं, मुझे आपकी बात से ये समझ आया कि हमने एक 1.5 ईंट की मस्जिद बनाई हुई है। अगर हम अच्छा कोई काम करने की कोशिश कर रहे हैं तो हम पाकिस्तान के लिए कुछ नहीं कर पाएंगे, बिकॉज वी आर इन स्मॉल पॉकेट्स। तो थैंक यू फॉर गिविंग अस दिस अवेयरनेस। और आपको जहाँ कहीं जिस लेवल पे हमारी ज़रूरत है, ये मैं आपको अश्योर कर सकती हूँ कि हम आपके साथ होंगे। और आपको बहुत ज़्यादा मुबारक हो, एंड वी आर ब्लेस्ड दैट यू आर हेयर। आपकी बातों से जो थोड़ा सा डिप्रेशन पैदा हुआ और खामोशी छाई इस हॉल के अंदर, उसको बैलेंस करने के लिए वी आर ऑल्सो लकी दैट लुबना इज हेयर। लुबना का थोड़ा सा मैं कुछ सेकंड में बैकग्राउंड बता दूंगी। लुबना इज फ्रॉम इंडिया। शी हैज डन हर graduation from in yoga and holistic sciences from India. Then she moved to Dubai, and I think for recent few years she is in Islamabad. Mashallah, she is an expert on her in her subject. But now I want Lubna to get us into few breathing techniques so that we all feel again positive and relaxed.
Okay, very first I would like to say thank you very much to Dr. 𝗟𝗶𝗳𝗲𝗏 for giving us at least half an hour for smoking. Okay, he has given us more than half an hour for smoking. So could you all stand for just 1 minute? Okay, in this 1 minute, we will just try to remove the impure air which has gone through us by sitting, which is called chair down syndrome smoking. So let's remove that chair down syndrome smoking. First, I would like all of you to give a big clap for yourself for being a very good human being over here. Now, those who have chairs in front of you, please just hold the chair to the support and kindly just raise your legs so that while we were sitting, the blood that is accumulated will start flowing automatically. So we will just catch the chair and raise your heels, go down again, raise your heels, go down again. That's a good thing. We are just giving a movement. And here we come. If you want to sit, you may please sit. And if you want to stand, you can also stand for this breathing exercise. Okay? This breathing exercise will be called 𝗟𝗶𝗳𝗏𝗏 pranayam, which is done by sitting, but I'll show you by standing. The rule for this is both your hands are over here, next to the shoulder level, and we will breathe in and take it up and exhale it when we come down. For example, the stomach is first inside. Inhale, take the hands up, and now put the hands down by breathing, exhaling out. Okay, this way. Once again, we start. Breathe, go out. This is all the air from down. We are from our belly button. We are just taking upwards and we are putting it outside. The next breathing we will start. You can just keep yourself standing over here. Once again, we go for Anulom Vilom. That is by keeping the thumb on the right hand side because this is the hot air. And we will breathe through our left nostril. Take a breath. Hold it. Release. Now take the breath from the right nostril. Hold it. Is that fine? Carry on. That's it, ma'am. Thank you very much. Thank you.
Thank you very much. That was some blood to the brain. Napoleon said, "Give me good mothers and I'll give you a great nation." And why not? Women empowerment, I think lifestyle medicine is a true example of that. Even Islam says, "Maa ke pairon tale jannat hai." And I must say, if our mothers were not empowered, we would not have been standing here. Our next speaker has come all the way from Qatar to attend this conference. And like our trailblazer, Dr. Shagufta, she is also another trailblazer in lifestyle medicine. She is Assistant Dean at Weill Cornell Medicine, Qatar, and advocate for public health, global health, and lifestyle medicine. She has pioneered educational programs such as the Lifestyle Medicine Interest Group Qatar and the Global Health Services Learning Program. With over 55 publications, she has made significant contributions to migrant health, chronic diseases, and integrative medicine in Qatar. Dr. 𝗟𝗲𝗂𝗍𝗲, we are honored to have you amongst us today. Kindly join me in welcoming her to talk about harnessing the power of lifestyle medicine to redefine health. Thank you.
I just want to keep some water. So, assalamu alaikum, everybody. Thank you so much for joining us today. My name is 𝗟𝗲𝗂𝗍𝗲𝗲, and I'm going to finish on time. So I'm going to try and just, go through the slides quickly. I do have some slides. This is how we go down. Okay. Everybody can hear me fine? Okay. So firstly, I would really like to thank Dr. 𝗟𝗶𝗳𝗲𝗏𝗏 for inviting me here today. So it's really my honor and pleasure. I myself am a proud Pakistani. I'm a graduate of Dow Medical College from Karachi. So alhamdulillah that I'm able to at least come back. I don't live here anymore, but this is my small contribution, hopefully, as we take the lifestyle medicine movement forward. And as Dr. Zafar Mirza said, it is actually a movement. If you see the amount of work which is now happening in the global arena in lifestyle medicine, it is a lot. The movement is going on, and now each of you are going to be part of that movement. So thank you, and a big round of applause to all of you for coming to this lifestyle medicine retreat. Next. Okay. So this is just my disclosure statement. I have nothing to disclose. I'm not a rich person. Basically, that's what it means. These are the 3 objectives I'll do. We'll talk a little bit about the promise of lifestyle medicine. How can we harness that power to promote health? And then I'll summarize a little bit of our journey that we've been able to achieve at the Institute for Population Health. So let's put things in perspective, right? अच्छा होता है कि हम हर दफा context में चीजें ले आएं, right? कि why are we talking about all this? Next. Next. Okay, so we are, of course, living in the 21st century, right? We've advanced medically, technologically, but at the same time, what are we seeing? There is an increase in the burden of non-communicable diseases, and predominantly a large number of them are due to lifestyle-related behaviors, right? So sedentariness. So I know everybody's talking about, sitting as the new smoking, but there is a large amount of published literature. So hum sab doctor hain, we practice evidence-based medicine, right? We are not quacks. So there's a large amount of published literature now saying, thank you, being sedentary is an independent risk factor by itself. So even if all of you say, oh, I am meeting the physical activity guidelines जो WHO ने निकाली हुई हैं for adults every day, right? Or for the week, what the guidelines are. But if you are sitting for a vast majority of the time, which probably all of us are, including myself, this is an independent risk factor for a lot of the non-communicable diseases. So I think we all need to include movement in our day-to-day activities. Jitna move kar sakte hain, aap karen. Stand, sit. In our offices, alhamdulillah, by the support of the leadership, we've been able to get standing desks now for the whole team. So including myself, we stand, at least I do, for a vast majority of the time, because we go to meetings, we sit, we eat, we sit. So there's so much sitting going on in our lives. So wherever you can, you need to go talk to somebody, don't call them. Agar office saath mein, go walk. Printing something, go walk to it. If you are going to a mall, thoda sa dur khada kar le gaadi ko. Everybody wants to, park right in front of the door. So there are small things, but if you try and include them in your day-to-day life, it will make a change. So anyways, so sedentariness, obviously poor eating habits. As Dr. Zafar Mirza said, even when I got my medical education, how much nutrition education did I get? Or who told me physical activity, is important for me to remain a healthy individual? I did not. So healthy eating, people are just, going towards easy, fast food, right? Processed food. And if you ask yourself what the meaning of processed food is, or even the meaning of food, what does food mean? If somebody can give me a good answer for that, तो मैं आपको खड़े होके इधर सलाम करूंगी कि food का मतलब क्या है? So I think it's elemental, and ये आप लोगों के लिए first step है कि you are joining the lifestyle medicine movement. Even for me, it's been a journey of self-reflection and a journey by itself, maybe in the last 10 years, right? So again, think about all these different pillars. Social media ka zamana hai, everybody talks about, right? Everybody's on social, but that is leading to a lot of interplay of psychosocial factors. Peer pressure, time pressure, stress is ubiquitous everywhere. Even little kids wo kahenge ki bacche ko bhi ab aajkal stress hai. So, but kuch good news bhi hai. I know Dr. Zafar Mirza ne, it's very depressing to look at Pakistan data, and that's probably not true for only Pakistan or bhi mulk hai, but Pakistan hamara mulk hai, so obviously we feel very sad looking at data like that. So there is good news that life expectancy has actually doubled in the last decades. But if you really look at what has led to that increased life expectancy, it's not us doctors writing prescriptions. There are public health measures, right? Vaccinations, availability, accessibility, hygiene standards. That has actually increased. So people are living longer. Next. So I looked at data for Pakistan, and this is World Bank data. So 2019, it was 67. But then in 2022, if you look at the lower one, it's 67. So the dip came because of COVID, right? But so we're doing relatively all right. Hamara Qatar mein life expectancy is 78. So we're doing well. But the highest are Hong Kong, Japan, with 85, 86, that kind, and some of the European countries. Next slide, please. So the world is aging. There is no doubt about that. Okay? So of course, if you look at the figures, aap dekhenge by 2050, actually there will be more than twice as many people above 60 as children under 5. And living longer is, mashallah, it's a remarkable collective achievement. हमें ये नहीं समझना चाहिए कि we are growing older तो बस life खत्म हो गई. We have to change our mindset. And I know that a lot of people living in Pakistan वो होता है कि 60 हो गए, हम retire हो गए. Honest to God, you go to North America, even in our, in Qatar, people are living longer, working longer. They're an inspiration even for me. Make it, like for us to sort of see how people are living longer. So I think we have a great opportunity in lifestyle medicine. how do we sort of evolve our lifespan, right? So it's incredibly, I think, living longer, jo wisdom aapko milta hai, and like you see that in our people, so we need that wisdom, right? It's incredibly a fabulous resource for us. Jo hum samajhte hain old ho gaye, khatam ho gaye, I think that's bilkul incorrect. So we need, people to grow age, but to live healthier lives. So next slide, please. So this is what it is, right? Yes, we are seeing people are living longer, but we are also seeing there's an increase in morbidity, right? So they're living with a lot of disease. So unki quality of life is affected. So we want people to be living longer, healthier, and well, right? Next slide, please. So good news to ye thi, like of course people are living longer, but of course the non-communicable diseases, if you look at the burden of that, it is humongous, right? Everybody knows this, and I just put this here because people want to say data. Wo kahenge, Sohaila, tum to keh rahi ho, but where is the data? Show me the data. So I just tried to put some data for y'all, so you know that these are real figures. I am not making them up, right? So NCDs, of course, everybody here knows what they are. They kill 41 million each year, equivalent to 74% of all deaths globally. And you can see a vast majority of them are, due to the jo maine figure niche dali hui hai, to cardiovascular disease, diabetes, cancer, mental health conditions, and chronic respiratory diseases. And again, each year, 17 million people will die from an NCD before the age of 70. So what are NCDs doing? Oh, they're causing premature death, right? So Allah ne, just everybody has been saying, Allah has given us a life to live. I think it's the greatest gift that Allah has given to us as human beings. Hum log us life ka khyaal hi nahi rakhte, right? We need to nurture the life that Allah has given to us. Ye amanat hai hamare liye. So we really need to work on nurturing the life, right? And of course, NCDs are hampering global development worldwide. You look at the healthcare expenditure because of these NCDs, it's in billions of dollars worldwide. Next slide, please. So if we look at the risk factors, next slide, and these, you can just go through. One more. That's it. Okay. So if you look at the behavioral, WHO ke hain, what are these risk factors, right? For non-communicable diseases, behavioral risk factors hain, tobacco use, other harmful substances, excess salt, sodium intake, excess intake of healthy food, excess alcohol use, and insufficient physical activity. Along with that, we have stress, we have poor sleep habits. Log samajhte hain sleep zaruri nahi hai. Or Dr. Shagufta ne abhi kaha, one individual just corrected his sleep. People say, I don't need to sleep. I think it's a waste of time. It's the biggest mistake jo hum as human beings are doing to us. Jo restorative processes sleep mein hoti hain. Ek Allah ka nizam hai hamare andar. We cannot get that if we don't sleep. And of course, it's going to affect our health. It will lead to all the inflammatory changes jo hamare andar ho rahe hote hain, which are leading to all these NCDs. NCDs ka base kya hai? It's the inflammation which is happening inside us at a cellular level. So, and then you've got these metabolic risk factors, right? Increase in blood pressure, overweight, obesity, high blood glucose level, high levels of fat in blood. And ultimately, kya hota hai? Of course, you will develop the NCD, and doctor, if somebody passes away in the hospital, cause of death kya likhenge hamare doctors? It'll be cancer, it'll be diabetes, it'll be cardiovascular disease. But we can all agree that the NCD paradigm is influenced by lifestyles. Can you please shift the slide? So the real killers are actually your modifiable behavioral risk factors. Nobody talks about them, and especially our medical community. And I agree with Dr. Zafar Mirza. We doctors are not the only people in the healthcare system. And I think हमें अपना mindset change करने की बहुत ज़रूरत है, you know, of how we function. We work best in a team. हम healthcare एक person नहीं कर सकता है, right? Deliver. So we work in a team. As important as you is the nurse, is the paramedic, and everyone else who is part of that, from a lady community healthcare worker also. So I think we need to bring back humility into ourselves and remember why we actually joined the profession of medicine. So Menika, okay, let's try and look for data on NCDs for Pakistan. Wo global figures I shared with you. But Dr. Zafar Mirza maybe has remained health minister. He probably has access to good data. But to find data for Pakistan, actually publicly, of course, I went to PubMed. You know, that's where we generally go look for studies or literature. Yeah, government ki I couldn't find much, right? And this was just a publication, year 2023 mein published hui hai. And it's in the Journal of Global Health, so it's a recent publication, and they talk about this, data on non-communicable diseases, a missed opportunity in Pakistan. So what they're trying to say in that is, there are many national level surveys, they are not tracking, right? And they are not reflecting the heavy burden. So even if there are some figures which are rotating, they are probably underestimates, I would say. They do talk about some surveys which are being done, but they are sub-national. Kuch provinces included nahi hai unme. So again, I think it's a wake-up call for our policymakers. Along with infectious diseases, no doubt, Pakistan is suffering. It's grappling with the double burden, hum isko kehte hain, right? We have the infectious disease burden and the non-communicable disease paradigm burden. In a lot of the high-income countries, so like Qatar is high-income, we don't look at it because बहुत ही small है वहाँ पे. So it's more the NCD paradigm. But of course, a lot of the middle low-income countries are suffering from both. So I think a clear directive now needs to, you know, come out from the government, really. So I also said, okay, let me look at the top 10 causes of deaths per 100,000 people. This is from the Institute for Health Metrics and Evaluation. So usme, of course, Dr. Zafar Mirza put on his slide, but you do, I'm not going to go on the infectious diseases, but because we are focusing more. So you will see ischemic heart disease, stroke, COPD, diabetes, cirrhosis, all these have, if you look at the root causes, they are modifiable, preventable, right? Aap apne behavior ko modify kare, and you will be able to prevent that disease from happening to you. Next slide, please. And these were the risk factors that are driving the most death and disability. DALIs hai ek term, policy makers istemal karte hain, obviously WHO bhi. So even here you will see malnutrition. So malnutrition mein dono aate hain. There's undernutrition, but overweight and obesity is also malnutrition. And then you've got tobacco, high blood pressure. So all of those are being repeatedly seen even in data for Pakistan. Next slide, please. So this was again a study, just to give you again, just estimates. This was prevalence of NCDs and their risk factors in a semi-urban community in Pakistan. And what they saw was that high blood pressure is the highest, about 39%. Diabetes is at about 15%, and all the others are there also. Next slide. This was another study. They looked at preventable lifestyle risk factors for NCDs in the Pakistan Adolescent School Study 1. They call it PAS-1. And they looked at basically 6 schools in 3 cities, in Karachi, Lahore, and I think it was Quetta. And what did they see? More than 80%, ye hum adolescents ki baat kar rahe hain. More than 80% mein unhealthy diets, 54% physically inactive. Most of the adolescents exposed to passive smoking, boys more than girls, and 14% were current smokers, and oral tobacco bhi use hai. And then 1/3 chewed betel nut boys more than girls. Next slide, please. So just to sort of show you this here, what they showed in this graph is the cohort that they looked at, 3% had no preventable risk factor, but more than 80% had more than 2 or equal to of these preventable risk factors, right? So I think a large amount of work needs to be done in our children, in the adolescents who are our future generations. Agar nahi, so I think we are moving towards, this burden of disease just increasing. Next slide, please. This was just a recent study in 𝗂𝗓𝗂, WHO ka journal hai, and they talk about the burden of non-communicable disease. It was a study done in Lahore. This has also just been recently published, so in 2022. And again, similar kind of figures aap dekhenge. But even in women, this was, respondents were predominantly women. So you can see that 40% had hypertension, 16% had diabetes, 17%. And risk factors wahi hain. 68% overweight, obese. 37% had pre-hypertension. Tobacco use bhi hai and alcohol. Next slide, please. So just, to talk a little bit about this, right? 90% of healthcare costs, USA and other developed nations, and I'm sure it's true for Pakistan also, they're directed towards treating chronic disease retroactively. Disease hoti hai, hum phir kehte hain ab isko sahi karte hain, right? After they have manifested. So again, like Dr. Zafar Mirza said, I think it needs to also be a paradigm shift towards a preventive model. Bhai, hame disease nahi chahiye. Obviously, doctors kehenge, phir hum kya treat karenge? So, but again, it's not going to go away so quickly either. It'll take decades, right? For your genetic signatures, everything to change even. But we need to start now if we want our future generations to be healthier. Next slide, please. So I just wanted to again remind everybody, right, of the things, and I thought these quotes were they resonated very well with me. And this was an article written by Sandro Gallia, just came out in August of 2024. And he's one of the deans of the School of Public Health in Boston. And he says dignity in healthcare is by advising clinicians to keep always in view the individual identity of patients rather than see them as faceless, interchangeable problems to be solved. हर चीज इधर हम solve करने चाहते हैं. हम क्या problem क्या है? I want to solve that. We are working in a very fragmented system. And what Dr. Zafar Mirza has said, who knows कि primary health care में यहाँ क्या हो रहा है? Has any of us ever gone and seen what is happening there even? यहाँ हमारे medical education में यहाँ जो हमारे healthcare professionals हैं. So I like to include health professions education in this. Are they aware of what is happening or what is really needed? Then, Francis Peabody, he was a physician. He wrote now he said this in 1927. It was an article which became very, very famous. It said the care of the patient. And I would like to remind everybody of this, that one of the essential qualities of the clinician is interest in humanity. For the secret of the care of the patient is in caring for the patient. I think we forget, that our patients are human. And a lot of the time, I hear this all the time, that doctor hamari baat nahi sunta. They don't care. They are sitting there just writing a prescription for me, and that's it. Okay, come back after 3 months, come back after that. That's about it. ठीक है? Our healthcare systems are deficient also, but I think it's time for doctors now to wake up and evolve. Their role is evolving because again, the oath that we all take is to heal and take care of our patients. At the core, always the patient has to be there, not me, not my business, or not how well my clinic is doing. And Dr. Bernard Lown, he was a cardiologist. He also in 1996, about 25 years, said, in the lost art of healing, that doctors no longer administer to a distinctive person, but they really concern themselves with the fragmented, malfunctioning body parts. And that's it, right? So if we don't talk to our patients about stress in their lives, ठीक है, patient आपके पास आया with diabetes, आप उनको अगर, you're not going to talk to them about the sleep habits, you're not going to talk to them about the social connect, about the stress levels, it's not going to work. And I think we have enough evidence. What else do we need? If it was only about prescribing drugs, the burden should have gone down, but it's not. So something is missing. And I think we all can agree to this. Okay, what was it that we signed up for when we became physicians, and what are we really practicing? Okay, Ji, so next slide, please. And this really takes me to the promise of lifestyle medicine. What is that promise, right? So again, we can try and address all these health behaviors. They are modifiable. A lot of the disease paradigm we are seeing in NCDs, they are preventable. So I think there's a huge promise in this for all of us to actually practice lifestyle medicine. Next slide. Okay, so again, the definition you will see, everybody will talk about it, everybody will repeat it. We try and all speak the same language, right? And again, revision is good for all of us, right? हम जितना revise करते हैं उतना ज़्यादा अच्छा याद होता है. So, but what I really liked about what Dr. 𝗟𝗶 Mirza said, and see, जो वो conceptual clarity की बात करें, don't think कि हम लोग भी नहीं सोचते, ये चीजें we do. And when he referred, and I really liked it, but ये चीज जो है ना, ये wisdom से आती है. The experience and the wisdom. So when we talk about, when he said कि हम इसको medical, you know, let's not call it a specialty, right? A medical specialty. And he's true in a way, right? But just to sort of give you a background to that, the definition has, for now, originated in the US. So in the US, people who practice there or have trained there, you know, everything, if you want to get paid, you know, has to be a medical specialty. There has to be a code attached to it. That's how medical system works there. And we also think about that. Okay, this is not what it should be. And hopefully, we hope with the conversations that we will have with our global counterparts, we hope that it will change. Also, the other thing that you said about therapeutic. So see, मैं सुन रही थी आपकी presentation. So therapeutic, we also say, we believe it should be there across, right? Everywhere, it's a lifestyle. So lifestyle as a medicine, but therapeutic only nahi hona chahiye. Preventive focus bhi hai. And that is what we are promoting also. Next slide, please. Of course, the pillars are there. Everybody knows these. So I think this is what it is. If we know the root causes of these NCDs are behavioral lifestyle medicine behavioral factors, lifestyle related, if we do not include LM, we are doing injustice to our patients, to our communities that we are serving. And the last line is just as a reminder, where Dr. Laun again says, doctors of conscience must resist the industrialization of the profession. Just a reminder again for all of us. Next slide, please. So let me take you on a journey. Okay? So what I will do is I'll share secrets of longevity and wellness from around the world. Everybody's interested? Yes? Yes, right? So next slide, please. Next slide. Next slide. Okay, so I don't know how many of you know him, but his name is Dan Buettner. Okay, and you can go back and Google him. And he has been working now for the last 2 decades with National Geographic, with the National Institutes of Health. They gave him money because they said that there are areas in the world that we live in, jahan pe log are living longer and they're living better lives. They are well into their 80s and 90s, and they have a large number of centenarians. So people are living beyond 100. Bhai, to kya hai unme? Why are they living more than, and they live well? Okay? So we will see. Next slide, please. So these are the 5 areas, and there's one in Italy, Sardinia, Italy. There's one in Costa Rica, Nicoya Peninsula. There's one Okinawa, Japan, and there are 2 more. So 5, you can go back and look at blue zones. It's a big project. Now in the US, there's a whole movement of trying to make communities into blue zone areas. Okay, let's try and, do what these people are doing so we can have better lives. We all want better lives. We all want healthier lives. Why not? ठीक है जी. So let's, next slide, please. So I already said this. Next slide, please. So what do you think it is that enables these populations to live the healthiest and longest? What do you all think? चलें कोई मुझे shout out करके बता दे. Huh? What do they have? They have purpose, yes. They walk as much as possible. Genetics to eat natural, yes. Yes, excellent. So let's see some of the habits that they have. Next slide, please. And of course, the secret, it's low tech. Huh? We don't need a lot of money. कोई ज़रूरत नहीं है iPhone लेने की. It's nice, but if you can have it, but to stay healthy, you don't need it. Next slide, please. So this is what it is. None of them smoked. 40 minutes of brisk walk every day. Greatest diet plan on earth. They call it 𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂𝗂 Islam bhi hame yahi bolta hai, right? Don't eat till you're full. If they drink alcohol, limit to 1 to 2 drinks. They eat predominantly plant-based diet. Go nuts. Pagal nahi hona, but just means 3 to 4 servings of nuts aap kha lein. Have a purpose in life. And see, again, purpose in life doesn't have to mean, everybody will not be Dr. Shagufta Feroz. But it can be, oh, okay, I'm going to get up today. I'm going to go do that walk. I'm going to get up. I'm going to see my patients and make their life healthy. I'm going to put food in front of my kids, which is a little bit any kind of purpose that you have in life that will make you healthy. Okay? Pray. So see, prayer is very important. So like for me, I think prayer keeps me very, very grounded in everything that I do, or belong to a faith-based organization. Let's move on, please. Next slide, please. And they also saw this. Okay? They were all likable people. They are interested in everything and are interesting. They possess compassion, right? So I think compassion is one key thing we all can practice, okay? And not about only compassion for everybody else, self-compassion bhi thodi honi chahiye, right? So very, very important for us. Don't just beat yourself all the time. Arey, main ye nahi kar, and of course, men are, basically considered as breadwinners, but all my sisters sitting here, think about yourself, please. Put yourself also first sometimes. No doubt, the family is very important. But if you are the anchor in the house. If you are not well, if you are not healthy, आपका निज़ाम नहीं चलेगा. वो जो system है, वो नहीं चलेगा. So no matter what, my apologies to the men. But no matter what, मैं तो यही कहूँगी. ठीक है. So ability to laugh होनी चाहिए, right? And you're either born with it, but you can learn it. ये बहुत important चीज़ है, right? कि how can I learn? What can I do? जैसे Dr. Shagufta कह रही थी कि we are lifelong learners. We enter the profession of medicine, right? So we will always be lifelong learners. And I think nobody should forget that. Anything, everything that'll help me feel good, improve my well-being, I want to do that. I want to try it. And then they give from their heart, right? So there's so many things. Again, लोग समझते हैं कि oh, it's only about monetary. It's not. सिर्फ पैसे की बात नहीं है. Charity can just be also, smile at a person, or just a simple handshake, किसी को एक खजूर खिला दें. Whatever you can do in your daily, day-to-day things. आप sweeper से बात कर लें, 2 मिनट खड़े होके. All of these things, will really help. So of course, ये blue zones का chart है. They call it just stay. When I say next, then please, okay? And they basically say it's the power 9. It's the key to wellness and longevity. And if you look at all these things, these are all related to what we are talking about in lifestyle medicine. Next slide, please. And again, I just want to remind everybody, this is what Thomas Edison said many, many years ago. The doctor of the future will give no medicine, but will instruct his patients in care of the human frame, in diet, and in the cause and prevention of disease. Ye thousands of years ki baat hai, pehle ki, not now. Another one, next slide, please. And this Hippocrates said many eons ago, if we could give every individual the right amount of nourishment and exercise, not too little, not too much, we would have found the safest way to health. This is what we need. Next slide, please. So now to talk a little bit about the evolving role, right, of us doctors. We are living in the 21st century. It's time to shift from chronic disease to chronic health. We need to refocus on health. Next slide, please. And what is it that we can do, right? So we want to promote chronic health. And how do we do that? We want to change individual behaviors, ultimately leading to change in behavior of our communities also. And also, at the same time, we have to establish social, economic, health models. And that these will then foster optimal health throughout the life, beginning even before conception. So this is really important. And I know there's a talk later on. So really, really important to think about life even before conception and what can we do. So we want to, then improve diet, exercise, mindset, lifestyle long before procreation starts, because it impacts future generations. There's a large body of science coming out called epigenetics. And what it really means is the experiences that children have at a young age, those become signatures in their genetics. So there is a certain degree of what we can change. Aap usko up-regulate or down-regulate kar sakte hain. But again, try and focus so that children in their, childhood get positive experiences, because it's going to help them in health throughout their life. We want to alleviate societal financial burden. Bahut zyada burden hai. Healthcare costs are humongous. Diabetes ki, even if, something as diabetes, which is so common, right? Uske drugs dekhe, insulin ki price dekhe. It's really, really impossible for people even to afford those. So we need to really, think about a paradigm shift. We need to prioritize health. And of course, it will benefit not only individuals, but the society. Next slide, please. So what does the paradigm shift mean? Next slide, please. This is what it means. Empower individuals to make informed lifestyle choice. One key thing is education for health literacy across all levels of the school system. If anybody can and has that power to make that change, we are imploring all government leaders also. We teach our children math, science, English. Nobody teaches them health. Health should be 101 right start from the school, because then they can make those better choices for themselves. And studies are available, published literature bahut hai, which show that jo childhood mein and during adolescence, the habits that they take, they will probably take that with them in their life, right? So hamare jo maps ban jate hain brain mein, sometimes they're very difficult to change. And people in public health and in medical practice, what is the first thing which we find the most challenging? Behavior change. Patient aayega, aapko kahega, no, I don't want to do this. That is like, I think, a reaction we all have. The first thing will be, no, mama, I don't want to, or no, dad, I don't want to, or, write me a pill, right? That's easier. I can just take that. It'll make me feel better. So education is really, really key. And starting again from schools. Of course, we want clinical services of lifestyle medicine and across advanced and multidisciplinary community healthcare models. And we use a multifaceted approach. One more, another one. And this is what it will do for us, right? To optimize individual, physical, metabolic, and emotional well-being to achieve holistic health. Next slide, please. So this is what it is. You are here, you have to be part of this revolution. You have a pivotal role, no matter what. आप एक बंदे की भी change करेंगे life, it has a ripple effect. They will take it back to their communities. We are seeing this in Qatar also. People who are coming to us, they go back to their practices. They are telling us, we've started an intake about lifestyles. You know, they say we've made change in our personal lives. You will make change in your households. It will be a ripple effect. So don't think you don't have the power to do this. You do. And each of you is empowered now. And you've taken this first step by coming to this conference. So I would like to commend you all. So of course, incorporate it in medical practice where you can, and the governments advocate for it, talk about it, you know, articles likhe. You all are a very privileged group of people sitting here. So use that privilege. And of course, everybody, where we are going now is we have to focus on self-care. It's not only about doctor batayega to maine ye karna hai. No, it has to be self-care and engaging with people to make them empowered. Next slide, please. And this is, you know, what the lifestyle medicine approach is. Generally, hum doctors, we are talking at our patients, right? But lifestyle medicine, we kehte, okay, we are partners. Let's sit and talk this through. How can we work at this together? So we coach them, behavior change karte hain. There are many different models. I'm not going to go into the detail of all of that. Team-based approach. I can't do everything. Nutritionists lie, you know, if you have an exercise person, bring that into your, send them. You probably have itna potential hai hamare Pakistan mein. There are so many young people coming out now as, you know, physiotherapists, as exercise, you know, jo usme hain, nutritionists hain, dietitians hain. Include them, even if we have the majority of doctors sitting here. If anybody wants to sit in my session, no problem. I don't have a problem. You can sit, you can walk around, kuch bhi karna if you don't want to sit. I mean, stand, what I meant was. So of course, you know, I'm not going to do a detail. I'm sure Dr. 𝗟𝗂𝗧 and her team are doing a wonderful job here, you know, doing workshops with you all, showing you all live sessions of what is happening in these clinics. So if you want to learn more, join them. And I would also like to commend 𝗟𝗏 University, you know, for taking this, giving Dr. 𝗟𝗂𝗧 that platform to take it to another level. हमें visionary leaders की बहुत सख्त ज़रूरत है. हमारे dean भी हैं Dr. 𝗟𝗏𝗳𝗁 Sheikh. He's actually from, so he's a dean at Weill Cornell Medicine. We are a branch campus of Cornell University. Hamara main campus Manhattan mein. But the dean of our school is a Pakistani. He studied at King Edward and went to Stanford. But he is supporting us in the lifestyle medicine work that we are doing. And of course, mere boss hain jo, he's the vice dean, Dr. Mamtani. He reports to him. But we need visionary leaders, right? Because I know Dr. 𝗟𝗂𝗧 will agree to this. हम जब उनके पास crazy ideas लेके जाते हैं, तो you know we say, oh, we want to fly. तो वो हमसे ये नहीं पूछते और ये नहीं कहते कि जाओ fly करो. They'll say, how high can you fly, right? ये difference होता है visionary leaders में, right? And that is what we need more of. Next slide, please. So physician competencies, again, you can review these. I'm sure Dr. 𝗟𝗂𝗧's course. I just wanted to put them out there. Leadership mein, knowledge. This is again what y'all are doing here by being here. Improve your assessment skills. Basically all pillars, we want everybody to include them. जो आप vital signs करते हैं, they are lifestyle medicine vital signs. Just talking एक दो सवाल. लोग कहते हैं हमारे पास time नहीं है. Okay, एक intake में आप एक सवाल extra कर सकते हैं अपने patient से. Just to help them, right? One question more. So think about these things, reflect. Management skills and use office and community support. I'm not going to go into detail. Let's just move through. Okay. Go through, go. Another. So we can share the slides with everybody. I don't have a problem. One more, please. More. One more. Okay. Phir, obviously, we are practicing physicians. People will say, do these even work? भाई आप ये सब तो हमें बोल रहे हैं, right? ज्ञान दे रहे हैं. तो do they even work? How do I measure that? So a lot of work is being done by the American College of Lifestyle Medicine. Lot of published literature, बहुत resources available हैं, but this is very recent. So if anybody is interested, please look at this publication. It's an expert consensus statement and it's defining metrics, right? To identify remission or long-term progress following lifestyle medicine treatment. So just look it up. You should be able to find it in PubMed. One more slide, please. Next. Yeah, I'm just giving you examples. You know, aap kahenge, acha, theek hai, you talk a lot, but how do I measure all this, right? Okay, so this was just recent. Again, just hot off the press. And these are now proposed nutrition and competencies. Dr. 𝗟𝗶𝗳𝗲 were talking about a medical education. So they already have a residency curriculum in place, but for medical students and physicians, trainees, a consensus statement has just come out. So lot of work is happening. Pura global movement chal raha hai, right? And you need to be part of that. Next slide, please. So that was more sort of just, you know, where I wanted to really invigorate you all. And I'm sure you all feel invigorated, right? Yes. So I think it's important to remind ourselves sometimes, why did we become physicians? We need to become healers, right? That's what we had to do. We promised to be healers of our patients. So let's try and do that. I'm just going to show you a few slides. There are lots of photographs, so I'll go through quickly. Now, this is just our journey, again, in lifestyle medicine that we've done. And this is just one bit of work that we do, you know. So we're a very small medical school. We take about 50 students a year. And the Institute for Population Health is just a small division in that medical school. We have a small team. जिसमें administrative लोग भी हैं, we have some research people, but we have about 12 people. But technical जो हैं, physicians, it's 2 or 3 of us, okay? So next slide, please. So this is what all of our activities are done under these 3 pillars. We do some education, we do some research, and we do some community work, right? So all of our different kind of activities fit into all these 3, and we try and collaborate with whoever we can. A lot of our collaborators are obviously also the lifestyle medicine global collaborators. Next slide, please. So this is just some of our research that we've done in lifestyle medicine. So we've looked at sleep, physical activity, burnout. You know, we wrote a paper during 𝗜脾 हुआ था in 2022, the big football, in Qatar. So we wrote scoring lifestyle medicine goals with 𝗜脾 2022, an opportunity to strike big. So we try and do whatever research we can in the realm of life. Of course, we do other research also, but our focus is more Qatar, the MENA region, in which Pakistan is also included, and sometimes global also, as per the needs. Next slide, please. So just talk a little bit about our community work, and wherever you can see. So this photo, the person standing in the middle is our dean, Dr. 𝗟𝗶𝗳𝗏𝗏𝗂 and this is my boss. हमारे academic systems में deans बहुत होते हैं, right? So anyways, so next slide, please. So we host a lifestyle medicine week, and ये community focus होता है. But again, since we are small, I can't do a population level, but we do it. We are part of Education City. Education City में 7 US campuses हैं. So all of those plus there's Hamad bin Khalifa. So we have about 8 campuses. So we invite students, faculty, community, their families, whoever they can bring and come to this event. So what we try and do during the lifestyle medicine week, we focus on a pillar on each day. One day is for physical activity, one day is for social connectedness. One day we have a huge event जिसमें we do a lot of these breathing, relaxation, storytelling, different times पे. Laughter yoga, so a lot of fun things where people can come and engage. So it's happening actually in October. The last week is when we are going to be hosting it. Next slide, please. Next slide. So these are just some things, we are doing push-ups, the boys come and do push-ups, planks. We had a walk. Next slide, please. Cornell cook-off hum karte hain for healthy eating. Once we'd called in like a chef, to show people how to cook healthy. And nutrition awareness hum bahut karte hain. So a lot of the people, they'll tell you, oh, I'm vegetarian, but why am I not healthy? Yeah, but what are you eating? Well, people will go eat, what your processed food milta hai, vegetarian burgers from frozen section. People don't know when we talk about food ki uska matlab kya hai. All the products that are available in the supermarkets, I know everybody here is eating them because of ease, but it's a big problem. So kabhi time mila to Dr. Shagufta ek workshop karna chahiye food pe. But we talk to people about labeling, label kaise padhte hain, ingredients kya hai, is this really food? Do you want to really put that inside your body, right? So things like that. Next slide, please. So this is on risky substance use. We call in, our partners, smoking clinic walon ko we call them in. We also have NOFR, which does for basically drug abuse. We call them in. They talk to people about it, hold little activities and things like that. Next slide, please. Stress management, again, breathing, relaxation, flexibility, mindfulness, laughter yoga. These are some of the things we've done. Next slide, please. Get connected ke liye, we call people, do a, form teams, come, we'll have fun. We do a little trivia quiz, give them some prizes. People form teams of 4 or 5, they come, we connect, have a little bit of fun. Next slide, please. Just to give you some numbers, we've hosted from 2018. COVID bhi aa gaya, but we went online. So Zumba hum online karwa rahe the logon ko. But of course, the numbers were a little bit less, but we did not leave it. But now the numbers are going up again. So we have about 1,800 people who've attended. Next slide, please. So for a CME, right, the continuing medical education, that's a big part of what we do. Next slide, please. So these were some symposia we've done. We did one in 2019. We did workshops, plenary sessions, poster presentations. Next slide, please. This was the recent one. Dr. Shagufta was also there. You can probably spot her sitting right there in the front. So this was redefining healthcare to promote well-being. We did it in February of 2024, and it was hybrid. So we had around 327 attendees, so it went very well. We're getting a very good response even in Qatar, from the whole Arab region, even from the MENA. Next slide, please. So then we started something which is now our flagship. We call it the certificate in lifestyle medicine. But we actually started with the certificate in clinical nutrition. Ye humne 2016 mein we started. We held 4 of these. It was sold out. 200 practitioners came through. But what we realized was that nutrition was only one part of the puzzle. We were leaving out a lot of things, right? And that is how we came to, let's go to the next slide, the certificate in lifestyle medicine. We started work in 2019. Next slide, please. And now we've hosted 7 cohorts. First cohort was in person, 2020 January. Then COVID hit, we went online. So we continued to offer it online. Last year, say, we started in person. And we just finished 1 cohort. We had 50 people, we closed the class. We just feel that that's, the maximum number we can engage with people. But we have a lot of requests, like for people to actually come join it. Next slide, please. Yeah, just to give you numbers again. So we've had 317 people who attended those 7 offerings. Large number are predominantly physicians. Next slide, please. So we are also a hub for IBLM certification, and through us, 77 healthcare professionals have become certified. 67 physicians and 10 healthcare professionals. Next slide, please. So this was the first Lifestyle Medicine Global Leadership Forum. It was again held on February 16, 2024. It was when Dr. Shagufta was there also. Delegates came from 22 countries, and we had a lot of discussion. And after that, we had the symposium. But the outcome was, again, something called as Doha Declaration in Lifestyle Medicine. Next slide, please. Now, this Doha Declaration, it's not only for Qatar. This is for the world. 22 countries have signed to it. So I think if you have a chance, please read it. Just Google it, Doha Declaration. It is there on the Lifestyle Medicine Global Alliance website right now, right? But we are in the process of getting it published along with an editorial in the American Journal of Lifestyle Medicine. So it is already in the public domain, but we are going to publish it also so you can actually have like a number, a DOI number to it. But what we are saying is advocating for LM, at least all health professionals, all, not only doctors, should have foundational knowledge of lifestyle medicine. We pledge, we advocate, we work not only amongst ourselves, but with everyone. Intersectoral, policymakers ke saath, unko what you have to say, you need to be the champions to take that forward, right? Next slide, please. So this is what the editor, it's been accepted. We are calling it a bold for a health. Next slide, please. And just to sort of say, of course, I'm working in Qatar. So Qatar just came out with a national health strategy, 2024-2030. So all of that work really resonates well with this strategy also. Next slide, please. So they have 3 priority areas, but I just want to, the first one is very clear, right? Improve population health and well-being. So all the work that we are doing, it resonates very well with the vision of the country. And just so you all know, Qatar has a huge network of primary healthcare centers. So like Dr. Zafar Mirza said, everybody doesn't need to go to the tertiary hospital, right? Otherwise, zukam hua, sar mein dard ho gaya, everybody's rushing to him. Don't overload your systems. Know where your primary healthcare systems are, even where your GPs are, even if it's in private practice. So if you can afford them, tell your people what to do. But they do have a huge network, and Qatar's focus is a lot on prevention, on wellness. They have a huge burden of NCDs, probably one of the largest in the Gulf region. But the vision, yes, they have money, but they are spending the money in the right direction. That is important. Next slide, please. Final thoughts, right? Again, some mujhe quotes bahut pasand hai. Huh? Next slide, please. So let's return to the fundamentals of doctoring, right? Currently, healing, I said, they say it's been replaced with treating. Caring is supplanted by managing. Hum care nahi karte anymore. And the art of listening has been taken over by technological procedures. So let's return back to the art of healing, which is what we were trained to do. Next slide, please. So lifestyle medicine is the way forward. We must identify, facilitate the eradication of the root causes of disease with health restoration and whole person health as the clinical outcome goal, period. That is what should be for us, a whole person health. Next slide, please. Paying attention to one's lifestyle is a cornerstone to maintaining and improving both physical, mental health, social bhi dal lein, spiritual bhi dal lein, right? Next slide, please. So let's collectively shift from a system of disease and disability care to one of true health care enabled. Next slide, please. I wanted to end with this. This is my last slide. This is from Dr. Atul Gawande. He's an MD, and he wrote this in a book called Being Mortal. And what he says is this. We've been wrong about what our jobs is in medicine. We think our job is to ensure health and survival. But really, it is larger than that. It is to enable well-being. And well-being is about the reasons one wishes to be alive, right? Those reasons matter, not just at the end of the life or when disability comes, but all along the way. So thank you, G. Next slide. Thank you for listening. If you want to connect, we are on all our social media platforms, and we do a lot of health promotion. But thank you so much for listening. Shukriya.
Thank you very much, ma'am, for such an enlightening and rich talk. Ma'am, you mentioned blue zones. And obviously, Dan Buettner, whilst traveling through blue zones, found that in Sardinia, Italy, and Icaria, Greece, were two areas where there were hills and mountains and slopes, and people used to walk on them. And that was one main reason for their longevity. That was the natural physical activity. So saying that though we should go to gyms, but we don't need gyms. Natural physical activity is what we should be doing. And relating that to the ayat from Surah Mulk, it is He who made the earth tame for you. So walk among its slopes and eat of His provision. And to Him is the resurrection. So obviously in Quran, it clearly says, walk amongst the slopes. So that's physical activity, and eat, but eat in moderation. Further, you mentioned about our double burden, infectious diseases and non-communicable diseases. Now, my pea-sized brain says the idea is, or the formula should be very simple. We should start working. We think that we need a lot of money for spending on infectious diseases to prevent them and on non-communicable diseases. No. I think if we keep spending on non-communicable diseases through lifestyle medicine and public health measures to improve longevity and decrease non-communicable diseases, the money we will save there, we can take it and spend on the infectious diseases, and that's how, in a circle, we can address Pakistan's health. So, moving on, just one question. What is the most productive age of a human being? 60 to 70. Excellent, yes. That is the most productive age. That was in New England Journal of Medicine. The second most productive age? 70 to 80. And the third most productive age, 50 to 60. So now coming to the point, Pakistan's average age, 67 years old. That's when we die. We get diagnosed at 40s and 50s with diabetes, heart diseases, hypertension, stress diseases. Even before reaching our most productive age, or in our decade of most productive age, most of our Pakistanis die. That's some food for thought. We have to think about that. And I think we can address it through lifestyle medicine and all that. So moving forward, because as I said, it's the decade which I would say is where we reach self-actualization. You all might know about Maslow's hierarchy, where basic physiological, safety, social, and esteem needs, when they are met, then we focus on self-actualization. I think that starts at a more mature age, and I feel that's my personal my personal thinking. You may not agree with me. Is at age 40 was the age where Allah revealed the first wahi on the Prophet. So that is where more or less maturity starts. From there, we start on self-actualization. So obviously, we should be working on that as well. Moving on, how to address these? Our next speaker, I must say this morning, when taking my printer and iron out of my mini house, which is my car, I keep everything there. I saw a car stop, and the guest who came out was a sigh of relief for me. I saw Dr. Abdul Jabbar. Dr. Abdul Jabbar is our next speaker. He is a seasoned consultant endocrinologist and diabetologist at Medicare Hospital Clinic in Dubai, with over 2 decades of experience, including 20 years at Aga Khan University Hospital. He is a founding member and former president of Pakistan Endocrine Society, recognized with Lifetime Achievement Awards for his contributions to diabetes, endocrinology, and Ramadan. A fellow of the Royal College of Physicians, Dr. Jabbar has also served as adjunct associate professor at Mohammed bin Rashid University and is an active journal reviewer for leading medical publications. He would talk to us about diabetes management revolution, prevention to remission. Dr. 𝗟𝗶𝗳𝗲𝗏. Thank you.
Bismillahirrahmanirrahim. Assalamu alaikum. Rather,
That's on, and this is how we move forward. Point backwards.
I know most of you are well aware of the topics we are talking about, and it's NCDs. But among the NCDs, I'm here and we'll be sitting on the dining table for lunch, and either there will be many questions or many free lifestyle advices from across the table, what to do to take care of your diabetes. So rather than giving a lecture on that, which encompasses a lot, it is a very difficult question: how to prevent diabetes, how to reverse diabetes, how to go into remission in diabetes. I don't have any disclosures. So the question comes from all of you, because you are now the advocates for the lifestyle medicine. If we want to prevent diabetes in our patients or people or community, at what age you will start looking into that? Any thoughts? 10, 20, 30 or 40, what age? 10. Is the prevention is meant for a person, for a family, or for a community? What is your target? If you want to prevent diabetes in me, what will you do?
She's going to talk to your mic.
Ah, right. Now let's come. It's too late. Right? When should have you talked? When I was 10, as per the common, right? Then it's not marriage. That's the point. As I say, the free comments come every time, but it's without realization where can we work. So I will just touch on some of the topics which will be, for many of you, eye-openers. What is the significant early life factor that influences the risk of developing diabetes later in life? Early life factor. So some of you said early life is 10 or even before 10. Before 10, right? You are coming now. How soon? How soon? Before 10 when? Yeah. What is the main reason behind? Is it genetic? Is intrauterine? Is childhood diet? Or it's exercise habit in adolescence? What affects the most? Childhood diet? Wrong. Intrauterine. Now, second question. If it is in my genes, can you change intrauterine? How? No, that's epigenetic. It's in my genes. It's in my genes, not epigenetic. What is epigenetic? Epigenetic is the influence of environment on the genes. So my 2-cent argument here is you cannot change your genes. So don't focus on that. Right? What you can change is epigenetic. And when you can change epigenetic? Intrauterine. Right? So for my kids' prevention, you should talk to my wife, not for me. Correct? So important question. Offspring of mothers with gestational diabetes. So that's where the intrauterine environment comes in. Are at high risk of developing which of the following conditions later in the life? Type 1 diabetes, hypertension, type 2 diabetes, metabolic syndrome, or osteoporosis. There are no wrong or right answers. What are your thoughts? Type 2 diabetes, right? So that's where we all agreed, intrauterine environment. We didn't talk about the gene here. It's the gestational diabetes, which is epigenetic. So if we can prevent gestational diabetes, you can prevent in the next generation, and this is a sizable population. In this region, about 30% of the ladies develop GDM. So you should focus before they get pregnant, not after they get pregnant. Now, how does maternal obesity during pregnancy impact the offspring's risk of metabolic disease? It leads to a decreased risk of diabetes, no effect, increases the risk of obesity and type 2 diabetes, and it only affects the offspring if they also become obese in adulthood. So this is not gestational diabetes. What is this? Just maternal obesity. And I won't quote the numbers. How many of our mothers are obese? Any idea? And how many of us counsel our patients or people, first you lose weight, then get pregnant? Nobody. We never talk about it. They come to us once they are obese, plus we say, oh, you're obese, you may be gestational. We check them, they're gestational. As I say, it's too late. We should focus much before that. So now comes the nutritional status during pregnancy. Have you heard about the thrifty phenotype? What is thrifty phenotype? The mother is undernourished, and that happens in our rural area. And Dr. Zafar mentioned about the maternal anemia and everything. Why it is all happening? So in our rural areas, till a while, as far as I know, the mother or would-be mother is the last person to eat whatever is left. So she is undernourished and she's working the whole day, maybe in the field elsewhere. So she's not obese. Number one, she's not obese. Number two, she's undernourished. This is called thrifty phenotype. So if the thrifty phenotype hypothesis suggests that fetal adaptations to undernutrition may lead to enhanced athletic performance, they will be very strong, lower birth weight, increased risk of insulin resistance and type 2 diabetes in a nutrient-rich environment, and increased intelligence. Which is the correct answer? B or C, correct? So I used to give lectures about 20 years back as part of my profession. Then we talked about thrifty phenotype in the developing countries. And I used to explain to the young doctors, you know, when your mother is 50 kilo, the nature thinks the child should be 50 kilo also. So the nature gives you a pancreas to take care of 50 kilo. But your family status changed. Now you are 80 kilo. But your pancreas was fitted in your body for 50 kilo. It cannot work for the another 30 kilo. So the second important thing, you avoid obesity and gestational diabetes in mothers, but at the same time, there is another group which is undernourished. Nourish the mothers before, and it's very unfortunate. I won't comment into that, but this is for the important policy makers. If a mother is undernourished, she gave pregnancy, she lactated, she delivered. Within 2 years, she got pregnant again. Within 2 years, she got pregnant again. Within 2 years, she got pregnant again. She has got 5 children. She, whatever she is, but these 5 children are now prone to diabetes. So early, the preventive. This is the true aspect of prevention, which is totally missing in our healthcare system. And the antenatal care, when does it start? Before pregnancy, not after pregnancy. So it's missing there. The thrifty phenotype hypothesis is relevant in which of the following environments? Only economically poor areas, both economically poor and high income areas, only in areas with a history of famine, only in developing countries. B, both, correct. Let's move forward. Which population is often cited as an example of thrifty phenotype hypothesis? Have you heard about Pima Indians? The diabetes prevalence for type 2 in Pima Indians is up to 80% because they went through the phase of thrifty phenotype. They were very much going through famine, starvation, and everything. Then that suddenly changed. Like, so Dr. Chauhan, you say, the Middle East countries have gone through this. And that's why the prevalence of diabetes is humongous. They were not like this. They suddenly became very rich. And now everybody is in problem. So this is another one. How do epigenetic changes affect the offspring's risk of developing diabetes? They affect only the appearance, they modify the gene expression, no impact, slowly improve the intelligence. So that's where the epigenetic comes. The modification of the gene expression. Gene was there, but in most situations we should understand the gene expression is increased or fastened. It's not slowed. So if the gene was there and the environment is bad, then the gene expression will get quicker. So instead of getting diabetes at the age of 45, I'm seeing, and many of you will be seeing if you're practicing, young patients with type 2 diabetes age 20 and 25. This is the acceleration of epigenetic expression. The gene was already there. So this is a common knowledge. If both parents are diabetes, what is the risk of type 2 in the kids? 90%. Right? And I won't ask any of you among your friends and families where both parents are diabetes. Just think about it. How many of our close people and family members are suffering from this? So the risk is high, high, and high. It's very difficult. So we have to look into preconception. There's a lecture for that. We have to look into during conception and things like that. Then we come for a person who already has diabetes. Oh no, still not diabetes. What comes before diabetes? Pre-diabetes. So should we try to prevent diabetes by managing pre-diabetes? Yes or no? Yes. Why shouldn't we prevent pre-diabetes? Correct? If you want to prevent diabetes, you should manage pre-diabetes or even before. How would you prevent pre-diabetes? Yeah, but how will you know that? Family history. So my common question is not in this forum, which is lifestyle, in my usual forums as well. Why would that person come to you? He doesn't have any symptoms. You will go and search for them? How will you find it? A pre-diabetes, I'm not talking about pre-diabetes before pre-diabetes. If somebody is at high risk, why did this person come to you? Who is coming to you for risk? Right? There are people coming. I get in my patient clinics, many people coming at the age of 15 or 16 for what? Overweight. Now, with the social media, they want their weight to be down. They're not worried about their diabetes and cholesterol. They only want their waist to be down, their weight to be down. So they're coming to my practice. And when they come to my practice and I check them, they're not pre-diabetes. They're not diabetes. But what are they? They're obese, right? So we should start working on that. The other way I work on these people is when I'm managing their mother or father, I ask them, how many kids you have? They say, I've got 3 kids. Very open question. They may like or they may not like. How many of them are fit? What would be their answer? You cannot say how many of kids are overweight. You cannot say that, they will mind it. But what will you say? How many of your kids are fit? What would they say? My 2 daughters are overweight. My 1 daughter has polycystic. Now they come to tell you what. What should we do? Check them or not? That's the point. You engage the parents to get their kids into the clinic or into the laboratory for testing before they have developed even pre-diabetes. What comes before pre-diabetes? So what is early management, pre-diabetes? What comes before pre-diabetes? Obesity. We all agreed, right? What comes before obesity? I talked to you about what is the early life risk factor for diabetes? Gestational diabetes. If mother has gestational diabetes, what will happen to the kid? They're not diabetes at the age of 10. They're not pre-diabetes at the age of 10. What are they? What are they? Overweight. Correct? And for overweight and obesity, you don't need a blood test. Do we need a blood test? You can see. An expert physician can see and say, this person is overweight, enough. If he is overweight, what's the problem? What comes first, insulin resistance or obesity? $1 million question. What comes first? Obesity, correct? What age? Oh, then we were talking about 10, 20 or 30 or 40. Look at your own family. What age your kids get overweight? 12 to 14. What age insulin resistance starts? Before they are born, in utero. That was the whole discussion. The mother has issue, that is the epigenetic. The mother had diabetes, the mother had obesity, the mother had pre-diabetes, the mother had gestational diabetes. The gene is there, but the early expression takes place, and that's why does in patients with diabetes or gestational diabetes, the baby is born big, right? This is the obesity before they are born, right? They are not eating anything. They are in the mother's womb, and they become obese. Why? Because the high glucose in the mother increases the insulin release in the kids, fetus, and fetus becomes macrosomic. So the first thing which comes is not obesity. The first thing which comes is insulin, and it starts before you are born, but then comes the environmental or lifestyle factor. And I tell many ladies here, some gents here as well, everything is concerned. In the first 5 years, if some child gets obese, whose fault is this? Number one, genes. You can always blame the genes easily, right? Gene comes from where? Mother or father? Both. So that's number one. But who is giving food to the 5-year-old? He is going to McDonald's himself? Who is feeding them? No, some fathers also. I cannot blame mothers only. But that's your choice, right? Your choice now. So if you want to change, where will you change? The mother's knowledge. जो मैं हमेशा कहता हूं कि मेरे माँ बाप ने मुझे सिखाया था रोज चावल और रोटी खाना और दिन में 3 खाने खाना. ना कुरान में लिखा है ना हदीस में लिखा है, मगर मेरी माँ ने ये बोला था मुझे कि 3 बार तो खाना खाना पड़ेगा और प्लेट खाली करनी पड़ेगी, खाए बगैर नहीं उठ सकते. तो आजकल अगर माएँ नहीं सिखा रही तो वेरी गुड, राइट? व्हाट इज द बेस्ट जज टू कंट्रोल योर फूड? योर एपेटाइट, नेचर. But what makes your appetite more? If you eat carbs and if your insulin is high, you will get more appetite. So that's something to discuss. What comes first? Now that's the important part. Look, when the hyperinsulinemia starts, then lead to overweight and obesity, then impaired fasting glucose, then impaired glucose tolerance, then pre-diabetes and type 2 diabetes. It keeps going on from a very, very early stage. But we are all starting to do everything once diabetes has started or pre-diabetes has started. We are already too late. But can we do something before? Can we do something before? Look, what is the root of every problem? Insulin resistance. It leads to central obesity. It leads to hypertension. It leads to impaired glucose tolerance, type 2 diabetes, polycystic ovary syndrome, dyslipidemia, infertility. Insulin is a big, big, big player. Where did it start? We have talked about it. But now it has started. The person is in front of you in your clinic. Many of the ladies who we are practicing, the most common reason the ladies or the girls come to your clinic is polycystic ovary. Now, what we do? Check. Checking early is important. Now, what is important? Pre-diabetes. Look, we all target the diabetes, even in gestational diabetes, to have an A1C below 7 or 6.5, right? We are too late again. For the reason, look at this slide. Even in persons with A1C of 5 to 5.5, there is a risk of future diabetes 2 times the normal people. It's 5 to 5.5. And our people are happy, मेरा A1C तो 5.6 है, 5.7 है. When does pre-diabetes start? What A1C? Which A1C pre-diabetes start? 5.7. Look, it's 5 to 5.5. And the risk of future diabetes is doubled. And what to do for that is important. So we should start very early, even to try to prevent prediabetes. How can we do that? Let's look into that. We're all talking about insulin, but in our practice, we never check insulin. What we check? Glucose. The person coming to my clinic, I went to my doctor because my weight is increasing. He checked my glucose and it was normal. He checked my A1C, it was not even pre-diabetes. So I shouldn't change, I'm fine. So I say, if somebody comes to my clinic and says, I've got headache, and I do his MRI, his blood test, everything is normal. Does it mean he doesn't have a headache? He has headache, correct? I'm unable to find the reason. It's medical professionals' incapability or inability to diagnose, but he has headache. So somebody is overweight, that means he's high insulin. But if you keep checking sugar, and if you keep telling the person you are good, don't worry, what will this person start doing? Nothing. So now, touching on that, what are these signs? Acanthosis, everybody knows that. And I won't ask anybody, when your person with obesity comes, how many of you look for that? Very few, right? If this is there, you don't need any test. This is a sure sign of hyperinsulinemia. But if you still want a proof, because the young kids believe in numbers, not what you advise or what their parents advise, check the insulin levels. So what people do, they check the insulin level. The insulin level is normal because the normal range in the literature is wrong. So I give you an example, very simple. In my laboratory, the normal range for insulin level is 10 to 23. Correct? If it is my blood test, the level comes as 12. Is it normal or not? Right. So just to make you understand, because we'll run out of time, if somebody is already overweight, 10 to 23, in the adult life, the only hormone which significantly impacts your weight in a person who has got hyperinsulinemia is insulin level. So if I'm already overweight, my insulin level should be 10 or 11 or 12, not 22. But the doctors sometime after my lectures, they check it. They check the level is 20 and they say it's normal. Even in Dubai, when I practice, they say, my doctor says your insulin is normal. It's not normal because you're already overweight. Your insulin should be down. But the important thing is to check fasting blood sugar and insulin ratio. And you can see the normal range for HOMA. This is called HOMA is below 2. If it is above 2, you are insulin resistant. And most doctors don't know about it or don't check it. So think of pre-diabetes now. That's where the following discussion will happen. That's where the lifestyle change should start. But nowadays, people look for some reason to start the changes. If somebody doesn't have high cholesterol, but he or she has got a strong family history of, Dr. 𝗂𝗂𝗧 is coming, heart attack. You keep telling them, your family has a strong history of heart attack, stop taking cholesterol. He will not stop. But when you share the number, look, your LDL cholesterol is 125 or 140 or 180 or 90, 200. He will say, doctor, give me a chance. You give a chance for 2 months, 3 months, still high, then he will start taking care of lifestyle. But otherwise not. They'll say, my numbers are okay, I don't have any problem. So that is when you prove with numbers, people believe in it that. But in the strong family history, it works. So you tell your family members, patients, family members to say, if you want your kids not to come my clinic in future, take care of them now. So the person who was bringing me yesterday from airport because we were stuck, he was asking me about, because he had diabetes and he was on insulin. He was asking me these questions. And I say, look, when I see one of my patients, I ask them, how many kids you have? He said, I've got 2 kids. I say, what diet advice have you been given? He said, this, this, and this. I was giving the whole chart. So I said, do you follow or the whole family follows it? So no, only I follow it. And the second example, just 2 weeks back, a young lady, 15 years of age, sent to my clinic because she had polycystic ovary syndrome and her insulin was checked and it was high. She came to me and I gave from my side, no nutritionists, etc. I give a 5-point rule plan. So I say for the next 1 month, you will do 1 hour of exercise every day and you will stop 5 things: sugar, rice or pasta, bread, potato, and fruit, and come back to me after 1 month. She came back to me after 1 month. How much she lost? 5 kilo. I tell everybody, take your waist measurement. I asked her, how much waist you lost? She said, no. The father was there. You say she is shy. I tell you, she lost 5 inches. So I say, you are one of my best students. So I don't tell them you're my patient. I tell them you are my student from today. So I say, one of your my best students. The father and mother exclaimed and say, doctor, she's not only your student. We are all your student. We all lost 3 kilo because we followed the same diet. That's the lifestyle, and where should it start? If you're already late, it won't work. So I think I will stop here. Oh no, one part is left, sorry. So that was about the prevention. But if somebody already has diabetes, you cannot prevent it now, it's there. Now you have to focus on remission. Do you think duration of diabetes, which one will be the best to go for remission? A, right? Everybody knows it. But all doctors try it later. Unfortunately, everybody tries it later. आपकी शुगर तो बहुत बढ़ गई है, 12% पे पहुंच गई है. अब कुछ करना चाहिए. यानी कुछ करना था तो उस वक्त करना था. Right? Now the second question is same. What A1C the chances are best for remission? Less than 5.7, right? But if you start late, you will not get into remission. You will control it. You will control it with a good doctor, good advice, lifestyle. I will talk to Dr. 𝗟𝗶𝗳𝗲𝗏 if she can teach me how to get remission in more than 8%. I will learn from you. That's what I'm saying. This is very good. So I'm coming to that as well. So which program has demonstrated that intensive life intervention significantly reduced the risk of developing type 2 diabetes? DPP. What was the mean A1C there? It was not 8, it was not 9, it was not 7, right? Even in the largest study, it was a good. There are individuals, I have patients who came to me with 12% and they are off medications. I gave them insulin for the first 6 months. So there are examples which are outliers, but we want to see the majority. Even with bariatric surgery, not everybody will get it, but they will get it. So what was the intervention done in this diabetes prevention program? No, what intervention has induced remission in a significant proportion? Which diet? Very low calorie diet. What does very low calorie diet means? Less than 800. How many of you can survive on 800? So it's not for you and it's not for me. I cannot, I tried it. I do everything on myself. So I tried. I can do it on 1200, but not more than a month. For 1500, I can spend the whole year. 600, even not for a week. I cannot do that. So if you have to achieve remission by taking a diet of 600 calories, it's not worth it. Allah Ta'ala ne kuch khane peene ke liye diya hai. Ye nahi ka bhooke hi raho, right? And the second thing is the most important, when did you start? Right? क्योंकि जितनी आपकी डायबिटीज आगे बढ़ जाती है उसके बाद आपका इंसुलिन जो रोल होता है, one is that your insulin mechanism is fully functional. The other is your insulin is lost. You cannot survive. So then you have to take something as a medication. Anyhow, so moving forward for the last couple of slides. So this was the direct study. And that's where I told you the A1C was not very bad. And this is your program, which you will discuss. So I'm not discussing it, right? Thank you very much.
Thank you very much, sir. In the interest of time, we'll move on. I would like to request Dr. 𝗖𝗂 𝗂𝗂𝗍𝗂 to come to the stage and then invite our guests to distribute souvenirs amongst our speakers.
Thank you very much, Dr. Omar. Assalamu alaikum, ladies and gentlemen. I'm Dr. 𝗖𝗂 𝗂𝗂𝗍𝗂𝗂. I request the Honorable Mr. Hassan Mohammad Khan, Chancellor, 𝗖𝗂 International University, Conference Patron-in-Chief, Vice Chancellor, 𝗖𝗂 International University, Dr. Anice Ahmed, and Chief Guest Dr. 𝗟𝗏 𝗟𝗍𝗂, Director, 𝗖𝗂 Institute of Lifestyle Medicine, Dr. 𝗟𝗏𝗳𝗏𝗏𝗧, to come forward and present souvenirs to the chief guests.
Assalamu alaikum again. I would like to tell you a little bit history of this souvenir. Souvenir, normally we see similarities in the souvenir. We have huge number of souvenirs and we don't respect them. So this time we have specially designed an artist who is called wire art artist. He was supposed to come today, he couldn't join. So every souvenir is a unique souvenir. So he can design only one piece once. So this is made of wire and wood. Yes, please. Naam bataiye, jo aapka hai.
So I request Dr. 𝗟𝗏𝗧𝗏𝗏 𝗟𝗏𝗧𝗏 to have his souvenir and the certificates. The souvenir has been provided to him, but a certificate will be presented today.
Thank you very much. Camera side, please. Thank you.
And I'll request Dr. 𝗟𝗏𝗳𝗏𝗏𝗧 Kazmi to come on stage for the souvenir and certificate, please. So the souvenir, after the lunch, please. Sir. Dr. Abdul Jabbar, sir. So, as the ma'am has said, that these are the beautiful masterpieces to present as souvenir. But one thing that is very important in them is that every piece has a story written. So I hope you will go back home, take them very nicely, and read the stories later on.
Very much.
Dr. Sohaila Cheema.
Great job. Thank you very much.
Dr. Agha Zahir Gul. So few souvenirs have been presented last night at the dinner, so they're here for the certificates. Yeah, given, yeah. And I request Dr. 𝗟𝗏𝗧𝗏𝗏𝗧 to present the certificate and souvenir to Dr. Anice Ahmed. His souvenir has also been given, and he's here for the certificate, please. Mr. Hassan Mohammad Khan for the souvenir, please.
Okay. Very creative, very beautiful, man. Thank you so very much. Two of my most favorite mediums as well.
I request Chancellor Mr. Hassan Mohammad Khan to share his insight if you have time, sir, to do that.
Bismillahirrahmanirrahim. Assalamu alaikum, everyone. So I've been carefully sandwiched between brilliant speakers and your lunch. So I better be very brief. So at the very outset, let me congratulate PALM for once again, organizing a brilliantly organized conference in very trying circumstances. My gratitude and appreciation for Rifa Institute of Lifestyle Medicine and Rifa team who worked day and night with the PALM leadership and the PALM team to make this conference happen. And of course, I'm thankful to our very dedicated, brilliant keynote speakers today and those who are going to follow, as well as the participants. I think Dr. Mudira ne bataya ke this, few ladies who had to come, dodge the containers and who made it to this place actually in a chingchi. So, I mean, that's phenomenal. I think that's a success. So I think if you look at a family unit, you look at a school, an institution, a cricket team, a soccer team, a university, or a big company, you always know that there are just a few people, one, two, or a handful of people who are actually the spark, the life and soul of that, that ijtmaiyat. And I think for lifestyle movement in Pakistan, of course, we all know that's Dr. 𝗟𝗶𝗳𝗏, who's always inspired us all. As in my position as a chancellor, I get to attend, fairly huge number of conferences on very diverse subjects, both nationally as well as internationally, whether it's, marketing or AI or computing or, health sciences. So when I always wonder whether I'm spending my time, optimally for my institution when I go and spend 3 or 4 days, especially if you go to, you go abroad. So for me, the KPI, whether the conference was worth it or not, are actually two key performance indicators. One is that did I really learn something which made me change myself at a personal level? Did it help me grow? Did it help? Of course, you get all the information, but that doesn't really mean that it's useful information if it doesn't really impact you. And second question is, because I go there in my professional capacity and my, going to these conferences is funded by the university. I don't go from my personal pocket, at least most of the times. So did it help? Can it help? And later on, did it help change my institution, the way I work and where my university, the way my university works in that particular discipline? So I think, Dr. 𝗟𝗏𝗧𝗏, I have to admit that both at a personal level, also as a university, not only just Faculty of Medicine, you have impacted us greatly. So I was, much to my shame, I have to admit, I started smoking back in 1987 as a young undergraduate student in US, and I smoked merrily till last year. And then finally, I just could not sort of reconcile between standing here talking about the principles and going back and having a smoke. वो मुनाफकत जो थी बहुत तंग करना शुरू कर दिया था उससे मुझे. And so ultimately I was able to quit. Yeah. And of course, my all-time favorite, and I actually live on a farm, and I had this cook and who made this fantastic 𝗟𝗏𝗃𝗏𝗏 from real buffalo milk. And that was like one of my guilty pleasures in life. But Dr. Saba convinced me that, making tea that way, it's very harmful. So I quit that as well. Never gone back to it. Which actually brings me to an area, of course, I think, we've listened to all the experts. I'm not even a medical doctor, what to talk about lifestyle medicine expert. So as a lay person, I would just want to share, a few things, experiential things. I think this is about 15 to 20 years back. I went through this book by Dr. Catherine Shanagan. She had done her PhD in genetics. She was an MD, and then her, doctorate in genetics from Yale. Brilliant book. And she talked about the fact that when she started her career, she actually thought about trying to identify an area where she would specialize, a disease, maybe one kind of cancer or some other disease, where she would want to spend the rest of her career trying to find a solution to it, to fight that disease. But very quickly, she realized that that's not really the right way of going about it. So, because there's just countless number of diseases there, and how many can you really tackle? How many of them can you truly treat and find, scientific breakthroughs to treat? So she said that I'm going to start focusing on not the causes of diseases, but causes of health. And this was, ma'am, probably more than 20 years ago. And you were talking about the blue zones, right? So she actually went to Okinawa. She personally went there, spent a lot of time, and she was a trained, geneticist. She went to the Mediterranean countries, to Sardinia. She actually went to and lived with the Maasai tribe in Africa. Again, all those places where you had the maximum number of centurions. She actually came to Gilgit and Sikardu as well. So, the health parameters are off the charts in this region as well. And after spending about 10 years researching these, causes for health, she came up with this book, and it's just changed my perspective on health, frankly speaking, again, 25 years back. And it's called Deep Nutrition. So she went very deeply into it. So yes, we talk about nutrition. हर बंदा बात करता है भैया आप सलाद खाएं, vegetables खाएं. I'm son of a cardiologist who founded Pakistan National Heart Association. तो हम 7th 8th grade में वो walk किया करते थे पनाह की मरी जाके, anti smoking, and so बचपन से घर का वो माहौल था, चिकनाई नहीं खानी, ये नहीं खानी. Not that it had too much effect on me, as you can see. लेकिन but it was there. But the fact is that today, and I think Dr. Zafar Mirza touched on it, touching on the food supply system. आप सैलेड खाते हैं, आपको नहीं पता कि उसके अंदर कितनी पेस्टिसाइड्स इस्तेमाल हुई हैं. Like I said, I live on a farm, so I had just this person who's working with me. So, and I had cultivated cabbage, and so one fine day he was, taking cabbage to the mandi to sell it. And 2 days before that, because I was taking a round, and I saw him, irrigating the field and putting pesticide on it. And just after 2 days, because he's an uneducated guy, he takes it to the mandi, and it's a beautiful fresh cabbage if somebody looks at it, but you don't know that it's full of poison. We talk about nutrition, ma'am, and I think that's where we need to have guidelines and deep studies by lifestyle medicine movement as well, and bring in food and nutritional experts as well. Actually, we requested Madam and our Faculty of Medicine to actually develop modules to integrate within our MBBS curriculum, right? So we've already done that, and for the last almost 3 years, hum padha rahe hain. So the idea is that each one of our medical student, when they become a doctor, they ought to be lifestyle medicine principles, and competency honi chahiye, compliance honi chahiye. But the fact is, again, coming back, कि nutrition पे there's research available कि अगर आप दूध को लेते हैं, and most of the people are getting your milk, and we are giving it to our children. Milk is very good. नाश्ते पे भी बच्चों को दें आप. So that milk, when you boil it over 90 degrees, which we all do at home, and also all these packet wala milk that you get, homogenized, pasteurized, which is very high heating. So over 90 degrees, the molecule of milk breakdowns. It stops being milk. Chemistry to padhi hogi, doctors aap log baithe hue hain, right? So what is one of the first principles that we read. I always hated chemistry, actually, personally. But heating changes the chemical property of a substance. So very few people know, again, that if you are eating paratha, but if you take wheat and you just high heat पे जो fry करते हैं, वो आपकी wheat की आपकी उसकी गंदम की nutrition को तबाह कर देता है. It becomes toxic. all of us, well, not all of us, but it's been a big challenge talking to my cooks and trying to change their paradigm. आप deep fry करते हैं तो आपका जो oil है वो toxic हो जाता है. So it's not enough for the doctors to talk about, ये थोड़ा सा अपना ख्याल रखें nutrition में. मैम, इसकी deep guidelines बनाने की जरूरत है. आप kitchen में practices को जहां पर, at least in Punjab, I don't know how it is in Karachi, पंजाब भाई जब तक खाने में वो तेल ना हो तो जी जायका नहीं आता. उस पैराडाइम को ब्रेक करने में मुझे 20 साल लग गए हैं अपने घर पे. So you have to really work hard. I could just touch on one little thing before I say Khudafis, which is we talk about epigenetics. We talk about genetics. Professor Saab just talked about the fact that if the parents are both diabetics, so 90% chance. So is it really genetics? Because this is a question which was asked and then researched by Dr. Catherine as well. And she said no. Most of the time she said no. Yes, 90% बच्चों को हो जाएगा, but क्यों होगा? इसलिए because parents को जो type 2 diabetics हुआ है वो उनकी lifestyle choices पे हुआ है. तो जिस घर में वो बच्चे जो हैं were born to maybe an obese mother, right? So वो जो बच्चे आप उनको उनकी नशोनुमा करेंगे, जो आप घर में उनको खिलाएंगे पिलाएंगे, जिस किस्म की लाइफस्टाइल आप देखेंगे सेडेंटरी वालदा की और वालिद की, they're going to follow the same thing and end up with type 2 diabetics. So this can be changed by choices. It's not just probably encoded in your genes that there is no choice, right? So again, wonderful being here. Thank you very much, everyone. Great job, madam, once again. Thank you. Assalamu alaikum.
Thank you very much, sir. It's always very nice to have your view on the conference. Now, my sugar level is going down, and I'm sure yours as well. So I would announce lunch now, but one announcement along with the lunch is we have sponsors for this conference. They have their stalls outside. So kindly visit the stalls. Obviously, they've been working hard with us. So they also need some appreciation and having a look around what they've been doing along with us. Thank you very much and see you after lunch. Thank you.